Okay, good afternoon, everyone. Thank you all for being here today. It's lovely to see so many people in our committee room on the Tuesday afternoon. And as we heard on the floor from Representative McGill, today is SNAP Awareness Day. And SNAP is a program that's offered via the Department for Children and Families, and it's exactly that. It's for individuals, families, older Vermonters, people with disabilities. It impacts a wide variety of individuals in the state. And so today we are absolutely delighted to have with us some folks who are going to talk to us a little bit about what that means in their day-to-day lives. So I'm going to ask Teddy to come up first.
So I am not Teddy.
Yes, I know. I realize that. You told me this was accurate.
Yeah. He is sick.
Oh, I'm sorry to hear that.
No, it is unfortunate because Teddy is much more fun than I am. But
Anyway, welcome, Lori. What we're going to do, because we have so many people in the room, and I would love for people to know who they're speaking with and what part of the state. So we'll introduce ourselves, and then we'll go all the way around the room for you to all introduce yourselves, okay? So my name is Teresa Wood. I represent Waterbury, and I live there, and I also represent Bolton, Buell, and Huntington.
Ann Donahue, Northfield and Berlin.
Good afternoon. I'm Dan Noyes. I represent Wolcott, Hyde Park, Johnson, and Belvedere.
Hi, everybody. I'm Julie McGill, and I represent Bridgeport, Middlebury, New Haven, and Weybridge.
Hi, I'm Noah Hyman. I live in South Burlington, and I also represent Williston.
Afternoon, Dane Whitman from Bennington.
Hi, I'm Ray Garofano. I live in Essex, and I also represent a portion of Essex Junction.
Hi, Norm. Philip Miles from Winooski.
Hi, I'm Jessica Brumstead, and I represent Shelburne and St. George.
And I'm just going to check in with Representative Paiella on the screen. I'm not sure if she's able to introduce herself. I know she's driving. Okay, so we do have Representative Paiella who is listening. She's from Londonderry, and I have to say she represents a bunch of other towns, but I don't know the whole list. But
North Committee Assistant.
Julie Burgess, SASH Coordinator, Downstreet Housing Community Development.
Polly Eaton, Neighbors in Action in Lindenville.
Andrew Portney, Groundworks Collaborative in Brattleboro.
Meg Atkins Office.
Cindy Brown, Neighbors in Action in Cabot.
Dale Brown, Neighbors in Action in Cabot.
Easy Hornglass, Executive Director of Neighbors of Bennington and Lindenville and Cabot.
I'm Monica Medeiros from the Department of Children and Families.
I'm Nellie Marvel. I'm also from the Department for Children and Families.
I'm Matthew Carey, and I'm Groundworks Collaborative.
Great. And Honora, you can introduce yourself and get us started.
Great. I'm Honora Horton. I'm a resident of Williston, and I am the Executive Director of Hunger Free Vermont. And along with Vermont Food Bank, Hunger Free Vermont has organized this second annual SNAP Awareness Day. And we made up SNAP Awareness Day last year. In March, because the pandemic era SNAP emergency allotments at the federal level were coming to an end. And when we realized how dramatic the drop in benefit levels was going to be for so many households in Vermont, we felt like it was really important for us to come here to the State House and have a day of kind of education and consciousness raising, if you will, about SNAP, what we call Three Squares Vermont in Vermont, and how important of a program it is. And also what was going to happen to people and to our on the ground community support organizations, so many of whom are represented here in this room today, when that drop in food benefits hit, and we in our communities were all going to have to scramble to try to pick up that slack and fill those gaps that the federal government, was creating for our communities and our neighbors and our families and ourselves. And, that drop really was dramatic. So households using 3 Squares Vermont lost an average of $100 to $500 a month in food benefits. And the crisis, the pandemic was a hunger crisis and is a hunger crisis. The loss of emergency allotments created another hunger crisis. On top of that, inflation created another. The flooding this summer created yet another. And so we are still experiencing the highest rates of hunger and people being at risk of hunger in our state that really we have ever measured. And that is in spite of many innovative, bold efforts that this legislature has put in place. And if those were not in place, I mean, of course, I think of the Universal School Meals Act as just one example of additional funding that this legislature has provided for the Vermont Food Bank Network and for Meals on Wheels. If those weren't in place, I can't imagine what we would be facing right now. But it's really challenging. And so we're here because we, even in the face of all of these challenges, what we believe, and the Vermont Food Security Roadmap that was just introduced here at the legislature last week shows is that it is possible, even with all these challenges, to end hunger in Vermont for everyone. That we can make policy choices that ensure food security for all of us in Vermont. And we're already on the road to making that happen. And there are some opportunities that you all have in the legislature this session to walk us a little further down that road. And one of those opportunities is to fund the Vermont Food Bank's $5 million request for base funding to allow them to distribute that money and food out to all of the network partners that are feeding people in our communities. Another is to fund the $2 million base funding request of the Area Agencies on Aging to support the Meals on Wheels program in Vermont. Now, Meals on Wheels is really a critical program that supports older Vermonters and people with disabilities who really have a difficulty getting food and preparing food at home. And that program is seeing unprecedented demand, and they can't meet the needs with the money that they currently have. Another is to fund the request for $478,500 in base funding from NOFA Vermont to operate 2 proven food security programs that also are farm viability programs. And that is Crop Cash. That's a program that doubles people's SNAP benefits, 3 Squares Vermont benefits, when they use them at farmers markets and farm stands. And the other is the Farm Share program that provides CSA farm shares to low-income folks. So, and then, of course, also to support H703, which Representative McGill is the lead sponsor on here. And there's a companion bill in the Senate, S215. And that that bill, H703, brings the restaurant meals program, would bring the restaurant meals program to Vermont. That's an option in the SNAP program at the federal level that states can take. And that program also specifically supports older Vermonters, people 60 and over, people with disabilities, and people who are unhoused in being able to use their SNAP benefits at eligible restaurants to buy meals. And that's really important if you don't have any way to store food or cook food. So that's really focusing in on a population in our 3 populations in our state who are most impacted by hunger. And then the other part of H703 would direct the Department for Children and Families to prepare a transition plan to put a state subsidized floor underneath minimum benefits for all households in SNAP and raise the minimum benefit level for Three Squares Vermont up to 30% of the moderate food plan. Now, the moderate food plan is what our JFO uses to calculate basic needs budgets. And it would raise minimum benefit levels that can be as low as $1 benefit up to more meaningful benefit levels for people who are just close to the income cutoff and really need Three Squares Vermont benefits. So these are actions that you can take, and we're asking you to do so. And rather than me taking more time, I think that what's really going to be most important for all of you is to hear from the other folks in the room.
I was just going to ask us to transition to hear from people with some lived experience, and really appreciate you being here and identifying the areas that we have before us and decisions that we have before us and the opportunities. And so appreciate that very much.
Thank you so much.
Okay. Let's see. I'm sorry, I forgot whose name was where. Matthew? Yes, okay, that's what I thought. All right, you're next. Thank you for being here.
Yeah.
And I would ask if people have written testimony, if they could forward that to Lori Morse, our committee assistant, then that way it can be in the official record. And that would be wonderful if you could do that. So the floor is all yours.
All right. Thank you for allowing me this time to speak to you today. My name is Matthew Carey. I live in Brattleboro, where I work at FoodWorks, a local food shelf there. I would like to ask you to please support the request for $5 million in base funding for the FY25 budget for the Vermont Food Bank to purchase food and support community-based partners, to establish a SNAP restaurant meals program in Vermont and create a plan to increase the minimum benefit level, $2 million in base funding to support the Older Vermonters Nutrition Program, and support NOFA Vermont's request for $478,500 in base funding for the Crop Cash Plus and Farm Share. I came here today to advocate for these issues because food insecurity is deeply significant to me. I'm no stranger to going hungry. Growing up, it was me, my father and my 3 siblings. Whenever we did have food, it was mostly limited to junk food and TV dinners. We rarely saw 3 meals in a day, only occasionally eating breakfast and never having lunch outside of the free ones we got from school. Food stamps have been a constant throughout my life. My father only worked sporadically, so it was usually our only budget for food, except for occasional trips to food shelves and whenever a community member would take pity on us and donate something. And that was a cycle that continued, as quite often we'd eat well for the first 2 months, for the first couple of weeks of the month, and then we'd go hungry until our card re-upped again. About 2 years ago, we found ourselves homeless and ended up being tenants of Vermont's hotel program. Which wasn't my first experience being homeless, but I was much younger then, and this time around I became responsible for grocery shopping with my family. And trying to shop for 5 people for a month isn't easy, nor is it a responsibility that I was prepared for. But what we got from our benefits, as well as community-based food programs, allowed us to eat comfortably. Things, however, were made much worse when the first of the month came around last March. Our benefits were abruptly slashed to 1/3 of what we had been getting. All of a sudden, food, which had been a challenge, became a crisis again. And to make matters worse, food programs, which had been allowing us to supplement our benefits, like the Everyone Eats program, started to shut down. Around that time, I started volunteering at FoodWorks, and while I had been to a food shelf before, I was usually on the other side of it. This time, it was different because I wasn't the one being helped. I was the one doing the helping, and I wasn't just coming and going briefly. I saw other people coming and going, and I was really taken aback. I'd always known that other people were going through the same things that I was, but when you're struggling, you tend only to think about yourself. Like, what am I going to do? Where is my next meal going to come from? And who can help me? But being there allowed me to see how much of a burden financially and emotionally food insecurity was on people, and how heavily they relied on their SNAP benefits and how that program was coming up short. Because of that people in my community, including myself, had to rely on different sources for food, like food works, like local soup kitchens, and the crop cash program, which allowed food stamps to go farther than they normally would. Now I work at FoodWorks, and I spend 5 days a week interacting with people who are struggling just as badly as I was and trying to keep themselves and their families afloat. It's been really disheartening. Programs like ours help immensely, but they can't do everything, especially now as we try to serve more people than ever. It's clear that not enough is being done, and that's why I ask of you again to please support the request for $5 million in base funding, the FY25 budget for the Vermont Food Bank to purchase food and support community-based partners, to establish a SNAP restaurant meal program in Vermont and create a plan to increase the minimum benefit level, $2 million in base funding to support the Older Vermonters nutrition program, and support NOFA Vermont's request for $478,500 in base funding for the crop cash and farm share program. Thank you for your time and your consideration.
Thank you very much. Thank you very much for being here.
Thank you. You're welcome. Thank you.
Cindy. Welcome.
Thank you. So my name's Cindy Brown. I've been a food share coordinator in Cabot for 18 years. This past year has been the saddest year. I'm not even reading my script here. It's been the saddest year. I'm just gonna talk from my heart. So our numbers have doubled. Like, we're doing 360 boxes every 2 weeks. And getting the food's been a really hard challenge. So yeah, it's been really tough on a lot of people, and we're seeing a lot more elderly people. And we live right on Main Street, and people would come to our house and say, "Hey, do you run the food share?" And we're like, "Yeah." Whereas my husband, he thought the guy wanted to volunteer. So he's like, "Why do you want to volunteer?" He's like, "No, we need food." So then one day I was at Tops in Hardwick, and it was actually Grand Union then. And this lady come up to me, she's like, "I don't have to buy cat food anymore." I said, "You don't?" She's like, "Nope. All that good food you give me," I thought her cat died. So I'm like, "Oh, I'm sorry, your cat died." She's like, "No." She said, "All that good food you give me," she says, "I don't have to eat cat food." And that's what's kept me there for 18 years. Just every time I think about, maybe I'm done, I'm like, "Oh, I can't. I got to stay here." So yeah. And it's sad to see how many of the elderly people, like last year at this time, we were probably doing 70 1-2 boxes, which is normally elderly couples. And now we're doing over 110. So that's how many we're doing of just elderly people. It's really sad to see the world come like this. I think it is sad. So yeah. So I support the 5 million for the food bank because they help us. Vermont Food Bank supplies us with stuff that we wouldn't be able to afford to buy everything. And then I support the $1 million for the other agent because we have a lot of seniors that come to ours. So we have senior adventures. They come and they get a meal and play games. We do that twice a month for them. And I support the 215, whatever it is. I support it all. Let's say that, okay? Because it's a tough world right now out there for everybody. Really is. I mean, if you even have a family with 2 incomes, say they're both on Social Security, they're not eligible for food stamps because they make $10 too much. And that's sad. You know, it's really sad. $10 too much, and they can't give them half the benefits. They don't give them anything. Yeah. So I guess that's all I've got to say. I won't take your whole day up, but thank you for listening. And yeah, it's really a sad world right now. Yep.
Tell them how we get the boxes from.
Oh, I didn't do the food share boxes, so I guess I'll go do that part. So yeah, I gotta go do this full time. So it all begins with volunteer coordinator, which is me, ordering the food off the website. And then we have a guy that picks up the food with a Penske truck that we rent every 2 weeks, and he goes and gets the food. And we have someone that picks up empty boxes for us at different local stores that gives them to us. And then the day of food share, we have volunteers come in that morning, and there's like me and my husband and 2 others gets there at 6:30 in the morning. And then there's like a bunch of others, like maybe 10 that comes at 8 o'clock, and they help us fill all the boxes. And then they leave by 11, and the kids come we have homeschool kids that come at 10:30. And so they load all the carts and they take them out to the cars and with the other volunteers and load them into people's cars. So they don't even get out of their cars. You know, it's hard for people to come get free food. You know, I've had to do it before. I know how embarrassing it is, but they don't even have to get out of their cars. They just drive up, someone goes and checks them in, and they get a number on the windshield. And then when their number's called, they just drive up and they load the car and they go. So we try to do cat food, dog food, paper products, whatever we can. Without the support of the food bank, we wouldn't be doing what we're doing. So thank you for listening to me. I do a good job.
You did.
I want to make it all day thing.
Thank you so much. Thank you so much. You did a very good job, Cindy. Appreciate it. Okay, and Julia.
Here. That's.
I will make this as quick as possible. So my name is Julia Burgess. I'm a SASH coordinator with Down Street Housing and Community Development. Down Street covers Washington, Orange, and Lamoille counties, and I personally provide SASH services in Cabot, Plainfield, Waterbury, Waitsfield, Warren, Montpelier, pretty much anywhere in the northern part of the state. So SASH stands for Support and Services at Home. It's a free health and wellness program that provides a continuum of care to support residents across the state of Vermont who qualify for Medicare. Downstreet SASH program area, as I said, is central Vermont and includes Washington, Lamoille, and Orange counties. The primary population that I serve is older adults. However, we do have some young adults with disabilities who are in our programs. Many of our SASH participants struggle every month just to afford basic needs, including their groceries, medications, and other financial obligations. Therefore, I am here today to ask you to support the $5 million in base funding in the fiscal year 25 budget for the Vermont Food Bank to purchase food and support community-based partners, to establish the SNAP restaurant meals program in Vermont, and create a plan to increase the minimum benefit level. The request for $2 million in base funding to support older Vermonters nutrition program, and NOFA Vermont's request for $478,500 in base funding for crop cash and farm share. One of the ways that we support our participants is through a partnership with the Vermont Food Bank. Because of this collaboration, we're able to provide many older adults with fresh fruit and vegetables through our food drops. So this request for the $5 million will really help us continue that program and maybe even expand it to some of our other building sites. The SASH program partners with lots of local and state organizations, nonprofits, which provide vital care to our participants. One of those organizations is Central Vermont Council on Aging, which provides case management services to some of our people. I hope you'll consider supporting that allocation of $2 million in base funding for the Vermont area agencies on aging to help support the increased demand for the Meals on Wheels program and to meet nutritional needs for the growing demographic of older Vermonters. I ask that you support S215 or H703, which seeks to establish the restaurant meals program for SNAP participants in Vermont, and direct the state SNAP agency to produce a transition plan to increase the minimum benefit amount to all participants. This legislation would act as another way to ensure our most vulnerable neighbors have access to a warm meal. Finally, one of the more popular programs that SASH participates in is the Senior Farm Share program through NOFA Vermont. This program helps not only our participants, but also local farms by partnering to provide fresh and healthy vegetables to older adults throughout the state. This is why I ask your support for the $478,500 in base funding to strengthen Vermont farm viability and address food insecurity by sustaining the 2 proven NOFA Vermont programs, the Crop Cash and the Farm Share. I appreciate the opportunity to speak with you. I know we're running out of time, so I will cut out my last paragraph. And I hope that you are able to show that feeding the most vulnerable residents is a priority for our legislature and our state. Thank you for your time.
Thank you. Thank you very much, Julie. And as I mentioned, it would be wonderful to have your testimony that you were speaking from for all the people who spoke today. If you could send that to Lori Morse, that would be great. And we very much appreciate the opportunity that you took to come talk with us today. And we will be over the next 2.5 to 3 weeks be working on the budget and budget recommendations. So you're actually the first ones to get a stab at giving budget testimony. So thank you very much for being here. Appreciate it so much. Now we're going to transition to the Department for Children and Families budget presentation. So I think they're waiting out in the hallway, if I'm not mistaken. Thank you all for being here. Yeah, already.
He brought hard copies. Do you want the hard copies of what she just said?
We actually need to put them electronically into the record. So, okay, thank you so much. Take care. Thank you so much. Thanks for being here today.
Thank you so much.
So committee members, you do have a presentation on the committee website for the Department for Children and Families. Me? Changing of the guard here, changing of the guard. Oh, yeah. So, you know, like gas prices and stuff come down, but food is just stayed up there.
We feel bad.
Hello again. Hello again.
Rich, you can just sit right down. Yeah.
Are you still laying?
No, if you know you're still laying. Yeah, could somebody close the door, please? Kind of noisy out there. Yeah. Thank you.
Is it okay if Sean pulls up the chair?
You can bring as many people.
I don't think we can fit everybody.
Right, you might need to like slow down, or you can talk from the sidelines. It's okay. Some people don't like that, but
Somebody's gonna.
pardon me.
Oh, perfect. Okay. I will.
Is somebody joining the meeting to run your slides?
Here. Sean, why don't you use that chair as your chair, and I'm gonna pull Kelly's chair over.
Yeah, Kelly's not here, so go ahead.
I guess I'll stay in the middle, maybe.
We just need to.
I'm missing the chair.
We have an hour.
That should be back.
Your computer's gonna last.
I think I have. Give it down.
Walk in and have somebody say.
Yeah, no.
I do have.
Give up your chair. Sorry for running a few late. We had some very fascinating testimony about the issue of hunger in our state, so.
Reach out.
Yeah. I got one bright spot in my week so far.
Yeah, I should to them, texted.
Yeah, maybe, I don't know.
Thank you.
We lost count.
I'm not gonna worry about taking.
Okay, so for members of the public, there is this presentation is on our committee's website, so. You let us know when you're ready.
So we're sending this chair.
I'm not gonna sit on the side. Tell you what, yeah.
Yeah, I want some new thing and then
Right.
shoot it up.
Take the chair if you need to. Be careful, Chance.
Almost there.
That's okay. We can be patient. All good. Who's minding things back at the shop?
Empty building right now.
I know.
Department of Health.
I was just gonna say, the Department of Health is taking care of everything now.
We're doing partying.
Fewer people than last night at the fire station also.
I was just saying, and last Friday, we ended with a lot of technical issues here. And I said, oh, it was nothing compared to last night at the fire station. Somebody counted, it went offline 18 times or something like that. It was not good, so. Is that a challenge? Yeah. But Lori does have her magic wand with her today, so she is a wizard, and if things need to be done, then it's real. That's right.
Love it.
Mm-hmm.
You think you need the Zoom meet again or?
We're good.
Take a deep breath.
I just consider this practice for going to appropriations.
No,
Yeah,
thanks for the warm-up.
exactly. Yeah. I suspect we'll be easy, well, no. It will seem easy when you go to appropriations.
That was a good framing. Yeah.
You still booked us until 4.
Well, we want to make sure we have plenty of time for you. As you know, you have a very large department that covers a big swath of the Agency of Human Services, so. John is co-host now. That looks like a good sign.
Yeah, we're good. Don't leave me. Better with Excel than Outlook. Are we live? Would it make sense for us to do introductions?
Excellent. And all eyes are on him.
Appreciate it. No, this is great.
Okay, so, yes, good idea. Thank you, Commissioner Winters, for that idea. I'm Teresa Wood. I'm from Waterbury. I also serve Bolton, Buell Score, and Huntington.
Thank you, Northfield and Berlin.
Hi, good afternoon. I'm Dan Noyes. I represent Woolkit, Hyde Park, Johnson, and Belvedere.
Hi, I'm Jubilee McGill, and I represent Bridgeport, Middlebury, New Haven, and Weybridge.
Hello, I'm Haugen. I live in South Burlington and represent Williston.
Dane Whitman from Bennington.
Hi, Ray Garofano. I live in Essex and I also represent a portion of Essex Junction.
Good afternoon, Kelly Small from Winooski.
Hi there, Jessica Brumstead from Shelburne and St. George.
And the wizard herself.
Lori Morse, committee assistant.
We go all the way around the room.
Oh, sorry. Sarah Kenny from Lester Kids. Brian Siegel from Benton, Vermont. Beverly Boquette from Bonneville Chocolate Advocacy Alliance.
Jean McCracken Group.
Katie McLean, Office of Legislative Council. Janet McLaughlin, Deputy Commissioner, Department of Children and Families.
Erica Radke, Deputy Commissioner, Family Services Division.
Monica Aaron's from Economic Services at DCF. Nellie Marvel, Director of Communications Affairs at DCF.
Okay, somebody's got to turn their
mic on.
Good now?
Okay, we'll
That's a good.
we'll see.
Right.
Okay.
Miranda, Deputy Commissioner for the Economic Services Division.
Steve Howard from the Vermont State Employees Association.
Kevin McCallum, 7 Days Newspaper.
And Lily, why don't you go ahead and introduce yourself too?
Thank you. Lily Sojourner, Interim Director of the Vermont Office of Economic Opportunity.
Thank you. I would say it looks like you're ready.
Excellent, thank you. And for the record, my name is Chris Winters. I'm the Commissioner of the Department for Children and Families and here providing technical support.
Unfortunately, Sean Benham, Financial Director, DCF.
See if we can share here.
Yeah, I'm in the meeting. Believe in us, we go. Share on Zoom. Share screen. It's the only option.
Ta-da.
All right. Excellent. Thank you, Madam Chair. Should I proceed?
Yes, the floor is yours.
All right. Thank you very much. And we appreciate being in here. Before we're going to appropriations, this is different. We brought a whole posse with us here today to be able to answer any questions that you might possibly have. It's our hope that we can get through it's 25 or 26 slides or so here today and defer to you as to whether you want to ask questions as we go. We'd like to get through at least a significant portion before we get to the housing or the childcare piece. I think pieces may have some significant discussion. So,
I think that what would be great is, so committee, if we can, if Commissioner, if you can sort of stop periodically, as we go through, but I'll leave that up to you as to where you want to do that. And then we can, so we're not sort of like have a whole bunch of questions all pent up. But the first few slides are slides that are sort of like a general overview and stuff. So we won't interrupt you.
Just let me know.
Okay.
Your preference, of course. So we'll start off with the first slide. If you could move it ahead, Sean. This is just a piece that talks about the mission of the Department for Children and Families. As you know, we're a part. And again, we would go into a little more detail with the Appropriations Committee. This committee is very well familiar that we're part of the Agency of Human Services. We foster the healthy development, safety, well-being, and self-sufficiency of Vermonters. And we're passionate about prevention and will reduce poverty and homelessness, improve the safety and well-being of children and families, create permanent connections for children and youth, and provide timely and accurate financial supports for children, individuals, and families. And this is where I turn it over to Sean to talk a little bit about some of the numbers. And we've tried to provide some visuals to go along with this to help you get a quick picture of the types of funds that we have.
Yep. So DCF, we have 13 base operating appropriations. There are 980 budgeted positions. That's position count. It's the GovRec for 25 is a $650 million budget, as you can see, largely general fund, 253 million, 115 million of special fund, and that's largely that new child care tax credit that's going to be coming in. Little less than $1 million for IDT, the interdepartmental transfers from around the state, other state units. 196 million of federal funds and $83 million of global commitment funds. And you can see at the bottom there, that's the relative change from the as passed 24 budget.
Okay, any questions here? Next slide. This first slide, this first more specific slide talks about the administration and support services, what we refer to as admin. This portion of the budget includes the personal services and operating expenses for the Commissioner's Office, the Business Office, the Economic Services Division, the Assistant Attorneys General, and IT services for DCF. John?
So again, you can see the gross budgets over on the left, and the table at the very bottom is the relative change across all of the funding sources. And then this just summarizes the ups and downs. I'm assuming you're not the Appropriations Committee, but you are comfortable with the ups and downs form that we use. This is
We use it all the time
you also
here.
use
Yes.
it. So just to summarize the craziness of those lines, it's 384 budgeted positions. So pay act and benefit adjustments is 2.2 million, and 1.7 of that is GF. Internal service funds, consolidated changes, it's 374, 288 of which is GF. We'll get to it later, but with the administrative component of Act 76, there was an appropriation for administrative function. So we moved some of the funding that was initially entered in as CDD. We have to move it up to the admin budget. We have 3 positions as well as some operating costs that we need to incur in the business office, as well as the IT, Dept ID within the admin level. So that's all that Act 76 from CDD is. That's a net neutral move from CDD up to admin just to right size where we incur these costs. Revenue adjustments, this is where I'm going to get myself confused by trying to summarize things. As you can see, that's down, and that's largely from moving ARPA stabilization base funding that we had. Again, this was the admin level of the appropriation, so CDD had a lot of the ARPA stabilization funding, but then the admin budget also had some revenue from that in our base budget. And this is largely moving that. ICAM provisions is actual programming. That is, we can defer later, but that's additional caseload services providing for the ICAM structure in ESD. We do have the $32,000 line for general assistance housing IT system, and then fully funding the 211 call center contract. And we've actually shifted that to be 100% global commitment this year. So that's a couple of moving parts, increased the line item for it, which had been funded largely by one-time funding sources to help get it along. We are asking for it to be in the base at this point, but we're shifting it to 100% GC. And then finally, operating cost. That's a typo there. So we switch that. So summer EBT program we're asking for in the base. It's actually 600,000 gross, 300,000 GF. It's a 50-50 federal funding source. So we would have 300,000 in the base.
And I think we do have a slide on summer EBT a little bit later in the presentation to go into further detail there.
What's this?
Steve, excuse me.
Sorry.
That's okay. Yeah. So it seems as though, so you're kind of through the overview of administrative services.
Admin depth.
Okay. So it seems like maybe now would be a good time to ask any questions that people have around that. Go ahead, Representative Brumstead.
I mean, this may be a question that's going to be answered later, so just tell me that. I just don't want to lose my chance. I'm just curious about the Act 76 from CDD, the 528 to 453.
Yeah, so the 528 is gross spending authority that we're asking for. So there's federal funds involved in that also. The 453 is the general fund. So the $4 million, the straight line that you can draw, the $4 million one-time appropriation from 24, we're annualizing that next into the 25 budget. 453 of that 4 million we're moving up to this DEPT ID. It funds 3 business office positions. And
so these will fund the positions that are not in the child development divisions.
That's right. There's 8 positions in CDD and 3 positions in the business office, and $167 in the IT appropriation for system upgrades and maintenance and making sure that we can, our systems can keep up with the changes.
This isn't even my part of the budget, but I work.
This is everybody's opportunity. Other questions in this area? Since we have the total base budget position count of 980, and you might get to this when we get to family services. So if that's the case, then I'll wait, but I'm going to ask in general, what's the vacancy rate at DCF and what kind of, how is it comparing to previous years? We have heard about some turnovers, turnovers. I'm not talking about the bakery good, but particularly in the family services division, we've heard about the stressors on staff there, and if you have any information about vacancy rates, and if you have it particularly to divisions, that would be helpful too.
With our deputy commissioners here today, I don't know if Deputy Commissioner Radke has some information, and she doesn't have the exact figures. We can always get back to them.
I don't have the exact figures, but I do know that as part of the New England Association of Child Welfare Commissioners and Directors, we did ask in that region about vacancy rates, and our vacancy rate was actually lower compared to the region. However, we have had a significant amount of turnover, but just relative to others in New England, it has been less, but I can't give you the exact.
Okay, thank you so much. I would appreciate that. And if you haven't, over the last couple of years, to be able to give us some sense of if there's change occurring, that would be helpful. All right, thank you so much.
And I can just add that anecdotally on my visits to district offices, particularly talking to Family Services Division, there's a big concern about the number of vacancies and how those caseloads get spread on others. We have a big focus among the supervisors and the leadership there around recruitment. Retention needs to be a big part of that, and how people are actually being treated and the work that they're being asked to do. We do see a couple of district offices where they've been able to really turn things around. St. Albans comes to mind, where they had a lot of vacancies and they've been able to turn that around in the last year. And so we're kind of focused in on those, what they did, what their strategies were, what was working successfully to bring more people in. And of course, we'd love to have all of our positions filled and lower those caseloads and the workloads.
And one of the things, and this might be something maybe to get back to us about, but I know I have had a constituent contact me regarding the, I guess you might call it supportive employee services around, particularly around youth workers. I don't know the exact title, but the folks working directly with youth, mostly in the Family Services Division. And the mental health supports for those staff, and at least previously feeling like they have actually decreased over time. There was sort of a high concentration of effort focused when one of the workers was murdered, and then people have seen a decrease in that over time, and certainly we know that there's a lot of stress happening. And so it would be helpful to hear what efforts are being done for employees in that regard, in terms of, doing some pretty difficult jobs.
I can talk a little bit about that. We do have what we call the HOPE team, which is individuals in FSD, other workers that have volunteered to support fellow social workers. And we also have licensed clinicians as well, when they're particularly tough staffings or tough issues that they need to be, that they need extra support for. And each district does have HOPE team as well as HOPE team volunteers. And that initiative being held, it's being led by our director of domestic and sexual violence. And it's definitely been helpful. But we are also looking to do other things to help our work, our staff, because one of the things I've just done is we have a new position that we filled with a director of workforce development, and she will be leaning in terms of making sure we have much more, not simply counseling, but also work-life balance, things like that our workers really feel that they need to have. And we're getting ready to issue an RFP for that director to have someone come in actually specifically dedicated to doing things like meditation and other things to help our workers really try to balance the difficult work that I know they're doing, because it is particularly challenging right now.
Thank you, Deputy Commissioner. One of the things that when people spoke to me about this is that they valued having somebody who was not an employee of the department to be able to, they felt it was more independent, and they felt safer in sort of disclosing whatever support that they might need. And so I would urge you to think about that. It sounds like that maybe is, when you're talking about an RFP, that sounds like an outside source. So I think that will be valued by employees, having an outside source.
Sort of half and half. Sometimes people want individuals that really understand their work and have done it, but then other times they're just saying they might want someone that's a step removed that they can really feel that they're open with.
Thank you. Anybody else have any questions in this area? Okay, thank you.
Next slide. We go next to the Family Services Division, which, as you know, works in partnership with families, communities, and others to make sure children and youth are safe from abuse, have their basic needs met, for example, food, clothing, shelter, and healthcare, and that they're free from delinquent behavior. They also ensure families are supported to achieve these goals.
So 382 staff. This is a large team. So 101.4 million as the gross number for pay act and benefit adjustment. 1.2 of that is a general fund request. Internal service funds, you can see it's a gross up, but a GF down. If I didn't present that before, on the left side, that's my gross number, and my net GF is on the right. Parentheses mean it's a reduction. So, and then revenue adjustments, again, large GF down there. This is largely because of the TANF state plan adjustment. It's actually a net neutral move where we're switching where we earn the federal dollar versus the state dollar with reach outs. See, of course. This is where if you're looking at the ups and downs, it's easier. In the summary view, it doesn't mean anything. But revenue adjustments, if you're tying out to the ups and downs, we are reducing the GF impact. At least in FSD. We'll see it elsewhere. PNMI changes. There's a couple of moving pieces in this. It's a $4 million gross up and a $1.8 million GF down. That's largely because we had a $2 million item that was built into the base last year's GF that we are converting back to GC for the 25 budget. So we're grossing it up. It's a $2 million GF down to gross up to a $4.6 million GC increase to allow for more resources for that activity. This also applies the inflationary adjustment that comes in. And the rule changes. So they are changing the rules a little bit. That's going to allow for slightly higher rates of the program too. So there were three primary feeders to that. PNMI line. The next two lines, really the next three, but the next two lines are caseload adjustment. This is the normal tracking that we do just to track how many cases are in a particular system and then what the average cost is. So for our foster care, the sub-care caseload, we are seeing reduction down. Caseload is down still. It is a GF up because of how the revenue gets applied, but the gross reduction. Sub-adopt, same thing. We're seeing slight downs on both the gross as well as the GF side. Support and stabilization, that is caseload driven also. It's an expansion of a very successful program. So we are asking for, that's all GC dollars, $1.4 million is GC for this.
Where's the state fund match for that?
Well, so for AHS, right? So AHS always has the GF that buys the GC, and then departments track it as a special fund, basically, as that GC specific dollar.
Are we going to see a little bit more about the details of what that investment is? Or should we? Oh, no, it doesn't look like we are. So it looks like we should ask that question now. I just moved ahead a little bit.
The support stabilization.
Oh, okay. Just want to hear a little bit more about the program.
Yes.
Oh, it's a great program. This is
I'd love to see you smile, Erica. That's a good thing.
It's really a commitment. This support and stabilization program. It's used particularly for our higher acuity youth. And this is run by Beckett and Vermont Permanency Institute, where they come in and it's really preventative in that you may have children that could possibly go to residential care, but they come in and support the youth in their homes. So it's like a really high-end wrap service. And one of the neat things about it is not only do they go to children in their homes or even foster home, but it's after hours as well. So it's when families need help. And they have this really neat emergency line where you can call and get assistance. And that's possible you can have people come out even at night to really provide the support that, kiddos need. And what this has done, and which is why we're really wanting to expand it, is because it's keeping kids at home that are really at a risk to go to residential level care. And when we have, with the designated agencies, and them being so compromised in terms of providing that type of support, this is something that we need really critically in order to make sure we're serving our youth as best we can. So I'm really pro on this.
So it sounds like this is something that maybe previously under maybe a lower dollar amount that you contracted with designated agencies for.
Exactly.
And now you're doing it through Beckett and the I'm sorry, I missed the second one.
BPI,
BPI,
that's what
okay.
I'm saying. And we,
Okay.
this is a way for us to buy additional slots from them.
Okay, and how many kids would that serve?
I don't know exactly. I don't have that number handy, but I can get that.
Okay,
You have that?
I
70
might.
kids? We'll get that.
Yeah.
okay, that would be wonderful. And how do families or foster families, how are they made aware of this as a resource? Because I could imagine you could have a bunch of people, calling in, but it'd be more than 70 families.
Driven by, and when we're interacting with the foster families and we see certain things going on, and we say, oh, this might be a house that's on the bubble. Let's try to get in there, provide some extra support. Then we come in with the strap.
Thank you.
And Madam Chair, just in a year where we were told not to present any new initiatives, this was one that Erica and team really fought for. That it proves its effective. It has proved its effectiveness. It helps with the high-end system of care and all the pressures that we're feeling there. We felt it was really important that we do increase this program. It's one of the few ups it is.
Well, I can tell you that 70 youth in residential treatment would cost a lot more than $1.45 million. So I get that. Other questions there on that for other people? Yeah, go ahead, Representative Brumstead.
So I'm not even sure exactly where my question fits. I'm trying to figure out sub-care caseload. That's the foster program. Is that right?
Very high level term that covers a lot of different activity.
Okay, and so yesterday I was at a meeting of the Kids Safe Collaborative in Chittenden County. And we talked a lot about the foster program and some of the problems with listening, really feeling like kids are listened to in the process. So I really am excited about this new program that you just talked about, because I think a lot of those kids are ones that may act out based on feeling as if they're not being heard. But I heard something that was a little bit disturbing, that there are some offices right now that have foster or children that need to be in foster care, and there isn't a spot for them. And so they are in the offices during the day, unless they're in school, but they're younger than, they're so young that they're not in school. They can't find a childcare slot for them. And they have them during the day in the office. And then in the evening, they're sort of taking turns keeping them. And I'm just curious, is that one of the things we put into the budget last year was some more funds to help with the foster program and giving to families? Is that having any impact? And is this been really tough, I guess, is my question.
It's funny that you mentioned that, because Commissioner Winters and I did a listening session with foster parents, and we also had a brainstorming session with the foster parent unit. And we were talking about retention and recruitment, and they had a significant amount of money last year to carry forward that they were able to use in terms of retention as well as recruitment that has been decreased. So I can believe that there have been some issues where we might have some kiddos that might be at district offices, but it's generally in terms of we still need to find the appropriate placement for them. And then sometimes it's a matter of maybe shifting other kids to a different home to place the youth in there, or finding other homes, and really just making sure that we can get the kid at the right spot. It's not always that it's a lack of placements, it's the better fit of placements is also an issue. But in terms of what we want to do with foster parents, we're really trying to make a concerted effort to make sure we're listening to them the same way you're talking about listening to the kids. Because we have had some feedback in terms of them wanting to make sure they're better connected with the district offices to get their needs met.
Okay. This was a little one who was not all I could think of was them being in the office all day, and
Sounds like fun.
yeah.
Having had a 2-year-old.
Yeah.
So just a second. So can you let us know when Representative Brumsted was referring to an increase, we specifically put in a budget increase to increase the amounts paid to foster parents. Can you tell us when that was effective and how much that resulted in?
Yes, thank you for looping me back. There was, I believe, a 5% increase for respite, and there's another increase in Haugen. You can remind me about that. We did make those increases in terms of pushing that money out to foster families. I think it was an increase in the rate as well as in the respite.
Yeah, I think that's right. Was it 4% or? I thought it was 4%.
Oh, we're asking you.
Yeah. Yeah, we can confirm it and then when it was applied in the
But
system.
it did go to the foster care rate as well as to creating additional opportunities for respite. So that's where the money went.
I'm sorry, I was just distracted.
Or, yeah, 4%, on both sides, on the adoption side as well as.
Okay.
Um,
Thank you.
We can confirm the
Okay,
dates. I think it was for the start of the fiscal year, but I would want to.
thank you. Representative Noyes, did you have another question?
Well, that was kind of my question. I'm interested in the supports for foster families around respite, and if you feel that the investments in this budget are enough to make sure people have access to getting a break and the respite. And is there a waiting period? That might be outside of your budget presentation. So, but
It's all
something that came
relevant.
to mind.
Fair game, fair game.
I haven't heard of any wait in terms of people getting respite. Generally when respite it's available and folks are able to access it. It was more in terms of maybe you wanted more than the typical amount of respite. I think that's where the issue was.
Okay.
And what was the other part of your question?
No, I think just making sure there was, Representative Chair Wood asked my question around making sure that there was this budget reflected an increase for the supports for foster families.
And it was definitely made to get.
And it's also for like clothing and other, is that part of that 4% or 5%?
That was just the general.
Right, I was just gonna say, the intent was for that to go for payment to the foster families. Yeah.
Thank you.
And I would just add that in the listening session and in the brainstorming session that we had, there just aren't enough foster families. We want more. We're asking about, does it make sense to do a big push on like marketing and recruitment? But the kind of the pushback there was, let's do more with the existing foster families that we have to support them better, because word of mouth tends to be the way that we get the most recruitment. So if we're not being present enough, if we're not providing respite, if we're not providing coverage for expenses or adequate reimbursement, that leads to a negative experience and fewer foster families overall. So I think we are going to focus on the retention side of things, and I'm really kind of excited to start working with Erica and team on that. It's been something I've heard about a lot, and I know that they've all been working on, but I finally just started to dive into that with them. And so we'll be making a push for that in the coming months.
Word of mouth goes both ways, right? So, so that's good to hear. Okay, let's move on.
And just a table for the case counts in foster care. So it is leveling out after the COVID drop.
Mm-hmm. And how does Vermont stack up to other states in this regard? In the past, I know, there people have said that Vermont takes more kids into custody than several other states, and I don't know how this compares to other states.
We unfortunately still do take more kids into custody. It is going downward, but we are in the top 10%, and that's something that I want to make a real push on driving that number down. And I also want to point out in terms of how the caseload numbers are decreasing, the acuity level of the youth we are working with is increasing. So although the numbers don't necessarily tell all of the story of the type of work that my team is doing.
Thank you.
We'll just skip C to D.
Yeah.
So,
I
okay.
suspect we'll have some questions here.
Or next up is the Child Development Division that works to improve the well-being of Vermont children by working with partners to provide Vermont families with access to high-quality childcare. That's through licensing, financial assistance, and statewide systems, and child development services through Children's Integrated Services.
It's a 54-person team. It seems bigger every time I walk through. You're doing good work. So PAC adjustments, it's an increase there. ISFs, I was able to adjust down. ISFs are balanced across the department, so some are up, some are down. It's more about right sizing it to how the bills are paid. Federal funding alignment, that is the rest of the ARPA stabilization, just getting taken out of our base budget. That grant is liquidated, so we're getting it out of the budget. Revenue adjustments is therapeutic childcare. That's it goes through our subsidy system. It's GC that covers specialized care, I believe. We can earn GC dollars. So this is buying some additional GC for where we're able to earn it, especially with the rate increases being applied. The corresponding amount of GC that we're covering for certain cases is going up. So it's net neutral in the account, but it's a GF reduction in favor of GC. Act 76 admin, so that 453 down. That's moving it up to the admin dept ID for the positions and some of the operating costs that had to go up.
While you're right there about talking about positions, so I get the 453. What I don't get is under PAC and benefit adjustment. Where does the increase in CDD staff show up? 'Cause that doesn't look like enough under PAC and adjustment to account for positions as well as those things.
The way that we're approaching it in the budget is that it was in the ups and downs, it's in the yellow section. So it's a change after the final. So the 50 million GF and 79.6 million, we're treating it as if it was in the base budget. So it wasn't in the base budget when we ended 24, but as we were considering 25, we were treating those as base activities. So that's why I'm showing it. The 4 million was assumed to be in the CDD budget. So I'm taking out of CDD and moving it to admin for the positions that are there in the operating costs. The rest are staying here. We do admin transfer.
Do you understand what I'm asking?
Yeah, so it is shown in the ups and downs. I have 1.4. So we assumed that it all went down into the subsidy category. Every dollar we got from 76, we were assuming was entered into one account in the grant section. So on the ups and downs, we're not sharing it now, but anyone looking at that, we actually have two numbers. It's the $1.1 million up, and then it's 4.2 in personal services, and then you have to look at operating too. This isn't translating super well between the two.
Talking to us or yourself?
Well, because I know you're not looking at this too. So
We're not looking at the ups and downs right now because this is supposed to be a summary of that.
Yeah.
So I guess, we can have our budget team who both happen to be not here right now, but take a deeper dive into that. It's not logical in my brain that the number of additional positions in CDD are represented here along with PAC and benefit adjustment, because that's insufficient number at the top.
Okay.
The positions from 76 are considered in the base in terms of how it says this pay act and benefit adjustment is on like the 54 people that we have. That's that adjustment. It is confusing the way that
I understand what you're saying.
It's not in that appropriation.
Okay.
They're also saying.
but but we needed to make an adjustment to admin because they all landed in CDD in 24. So, okay.
I can confirm that they're in the budget. I'm struggling confirming that they're on the slide.
Okay.
I think is where I'm at.
Okay.
Let's definitely follow up and confirm if it's within one of these numbers or if it was just a line that was missed to call it out specifically.
Okay.
I called it out on the ups and downs. And when I'm doing the quick math in my head, which is always super safe. I think you're right. I think I'm taking my non-Act 76 pay act in that 337. But let's circle back and confirm. I think I just missed it on the slide.
Okay.
But they are in the budget, the 8 positions, and the corresponding operating expenses are.
We have eagle eyes here. That's all I'm gonna say.
Oh, that's great.
I thought that's so.
No, it's not high enough. Okay. All right. All right. Now we're getting down to the fun part.
Almost there. Right Futures Fund redirect. So this is when there are those special license plates that you can buy through DMV. Those proceeds go into a special fund. DCF had the spending authority in our base budget for that special fund that we would then give to the Building Bright Futures State Advisory Council through programming. We're expecting an adjustment this year where DCF will no longer be the pass-through entity and BVF will just get the access to those funds directly. So this is just a technical move to remove that spending authority and getting us out of the middle. PDG, this is not new, but it's been a couple of years since we've had a PDG grant. It's renewing PDG activity, so it's building it into our base because we expect it to be around for a few years. So we're just building in the federal spending authority for that grant. And then, we're taking the $9 million off of the base for the CFAT caseload projection.
Anybody want to ask a question about that?
We do have a slide. We have 2 slides.
You have slides? Okay, I'll wait.
Two slides.
I will wait till we get to the slides then.
They're right next, so you don't have to wait long.
You want to do the programming stuff first?
Yeah, do you want to do that?
Number stuff?
Sure, so we did want to just highlight the key fiscal elements of Act 76. I know that we talked about them before, but just wanted to emphasize the fact that our intention is fully to implement the Act 76 and all the policy elements as intended. And so we've already done the two adjustments to the way child care financial assistance is structured and paid, both in July and in December. We are working towards another April date that would extend eligibility and adjust the weekly family share for one specific rate category. And then we're looking at it to another rate increase in July for family childcare homes. And then in terms of payments directly to providers, Act 76 readiness payments, it's 17.4 million of it's been committed. Final applications are due by February 9th, and then we'll know if we have enough money left over to be able to make one extra payment to programs. And then we are planning on doing, have also included the $10 million quality and capacity incentive program in the budget. So we just want to just clarify that all of the major fiscal elements associated with 76 are included in our plans and projections.
Okay.
Okay.
I can read we can read the bottom part.
And we'll cover it on this slide too.
Okay, all right. I'll let you go through the next slide.
So, and we'll break it into 2 different parts because I think there's been a little confusion. Hardy and Adam presented yesterday too as part of.
There's a reversion happening as well.
And the C section of the big bill for 25 does have an adjustment of $10 million.
Yes.
Also, that's for 24. That is not. It's treated like BAA. That's not a base cut that would revert throughout every other operating budget, right? That doesn't reset the base. It just adjusts the 24 amount.
So why is that happening in the 25 budget when it's 424 and why wasn't it done in the BAA?
I think as we've talked it through, it's because we were waiting, it was timed really because we had to have the BAA cooked. So the timing of the process, the 35% we didn't see that in payrolls until January. So that's after BAA is pretty well developed. So we had been tracking this and we knew that there was going to be likely some savings, but we weren't comfortable having any number actually presented as part of that build. So this is a tool that the administration has concurrent with BAA to adjust with 25, right? You're adjusting the prior year budget. But it was mostly for timing. I was pushing back. We were pushing back to get as much time as we could before we had to commit to a number. We've had a couple of payrolls hit, so we actually have some new current data after the 35% increase has been applied. Up until then, it's been all projection. It's all like, we haven't had any new income bands come in until April of this coming year, and then more coming in October. So the big caveat for all of this, it's all projection. We're doing outreach. We want enrollment. We want people to engage with the program and take advantage of the subsidies that are available, but it's all projection at this point. So for the 24 analysis, we're looking at the current data. We have actual bills that we paid through December. The average biweekly payroll has been about 2.8 million. So we have actuals there. The projection that I'm using for the January through June, it's about 4.1 million. So that's up to 45% increase. That includes the 35% increase, as well as a 30% utilization estimate for that new income band, the new income eligibility level that's going to be coming in. Realistically, that might even be a little high. I wanted to be as aggressive as I could with the numbers because I didn't want to undercut our budget. Because this is caseload, this is demand driven. But as you can see, I think I would expect, depending on where we come into that 30% uptake, $450,000 kind of in either direction. So that's like a $6 million swing over the next 6 months. Total gross projection of 91 to 97 million, and we have 111 million. So I think even the 10 million is probably not giving back every dollar that we might have at the end of the year. I think I've heard Adam Gresham describe it as being conservative in our estimates, and I think that's what we're talking about. We know how much we have available. We're scrubbing as best as we can what we think we're going to put out the door, following the rules. And I think we're going to be in the mid 90s. So I think we have more than we need for this year. Do we want to stop and ask questions about 24?
That sounds like a really good idea. So one of the questions that I would have is that obviously we worked closely with the administration on developing these estimates for Act 76. And I guess I'm just going to put it out there. So what is dramatically different? I mean, $10 million is a big chunk of money. It's a bit unusual. I mean, I haven't really seen a reversion like this before in the next year's budget happening like this. And it seems like some funny money playing around, to be perfect. I'm just going to put it out there. I understand that a reversion is not a reduction in the base budget. I get that. But then you are reducing the base by $9 million. So essentially it is. I mean, that's sort of the long and the short of it. So I'm trying to figure out, that seems like, roughly a 10% error rate in estimates. And, maybe for an investment this size, maybe that's not so bad, but I'm not convinced, I guess. We haven't even really fully implemented the program yet, and you're making reductions based upon estimates. And it seems as though that might more appropriately occur next year and not this year after we have actually fully implemented the program. And even then, when we move to 575, it's going to take some period of time before the uptake matches what the expected utilization is. So it seems premature, I guess. The long and the short of it, this seems premature. We could be wrong about that. And maybe you won't be coming back next year during budget adjustment and saying, oops, now we need more money. And I don't want to be in that position, frankly. So I guess more to follow on this. That was more of a statement than a question, I realized. Other folks have questions?
You just said it big time. I'm really concerned. I mean, we haven't even started the program really yet as far as the collecting of new funds for the with the payroll piece. And I'm worried about $10 million. Seems like a lot to be moving around. And I'm too used to it in other programs where we drop to the bottom line and move. And it becomes a regular occurrence. Shorting other really important programs. This is important, especially to this committee.
Other questions from anybody else? I mean, I think you probably were anticipating, a reaction like this.
We were hoping you wouldn't notice. We absolutely hear your concerns, and I think we share a lot of them. Took us a long time to get to a comfort level with this number, but I think we are there and understand that you all, there's a lot riding on this. You probably, and given the size of the investment, that maybe this number isn't so far out of whack, but it really is unusual, and understand that you have a lot of concerns about this approach.
And I mean, let's be honest, we're going to move on to economic services and OEO, and we're going to see where you put that money. I mean, that's what's really happening here. And I get the budget exercises that you folks go through. It just doesn't mean it's exactly real. That's all. So, okay. So obviously our budget team is going to be, delving further into this, but I think, we're just kind of putting you on notice that, reducing a program before it's fully implemented in an initiative such as this doesn't really go over very well.
Do you want to speak to the 25?
Yeah, and then 25 similarly, a couple of notes about where it's coming in. So there was, I'm calling it 14 million for the administrative side. So there was the $10 million for the quality and capacity incentive program. And we've started talking about that. We'll get that rolled out for July. $4 million for the administrative side. And I'm just breaking down a little bit where that's going. So the $1 million that's split between CDD and the admin depth ID. So there's $1 million for salaries, benefits, and operating for the 11 positions that were included, 167,000 for IT and system needs, $2 million for the CCCSAs that was prescribed, right? So we've already incorporated that into the agreements and we've built it into the base. Again, 266,707 for BBF, that was prescribed. And then as we were analyzing the 4 million, we had 485 that's going to be available for consultation, implementation support, a little more CDD discretion to fill the needs where they are, outreach definitely earlier on, rate setting models, things like that. There's going to be a lot of activity that's needed internally. We have administrative capacity for that also. So $14 million out of the Act 76 funding. Again, looking at $6.5 million. So just to put what my high estimate is, $6.5 million for that biweekly payroll, which you can see what I was projecting for the second half of 24 was 4.1 million. What we actually spent through December was 2.8. So that is a considerable increase as we're applying all of these changes. And the capacity that we're projecting out, $6.5 million per biweekly payroll. That's a weighted average of $325. That's the weekly subsidy amount being paid out. Again, that's across all of the income bands for all of the different slots, which have their own rates. We have the slide in there about what the updated subsidy amounts are. This is what I'm using as the weighted average from those, and it annualizes to about 17,000 per child across all of these programs. Again, that's my high estimate. So it's that's assuming utilization jumps up over 10,000. We're a little over 6,000 now, so this is definitely expecting growth in the program. And I do put the note that at this rate, every 1,000 kids that I'm off is $17 million. So that's a big swing depending on how popular or slow the uptake is here. My mid to high gross projection, 152 to 170, and that's out of the 179. So that we've had available, 63 in the base, 50 in GF, 80 million from the special fund, and then less that $14 million for admin. It's 179 to put towards subsidy. I think we're going to come in under that.
Well, the one thing I will say is that I am happy to see that at least 14 million of it is going to exactly where we expected it to go to. I don't think I don't think really need to belabor the rest of it since we've already talked about that. Just to be frank, it feels like you backed into a number. That's the way it feels. I'm not saying that's what happened. I'm just saying that's the way it feels, that you needed to come up with a number and you backed into it. So we'll look forward to additional dialogue on that when our budget team gets together with you. Thank you. And thank you for, it's good to see this rate chart on the next,
Yes.
on the next slide. And I do want to say that the chart that the team put together that gives us the updates on, when certain things of how, what the elements of Act 76 were, and then what the intent is and when they were implemented. I shared that with the health department and I said, this is something that you could utilize. And they actually have done it, around our opioid response and overdose response. And they looked at what you did. And I think honestly, it serves as an example for everybody in AHS, wherever there's a major investment in major activity happening. It gives us a snapshot in a very clear and concise way. So just after being rather negative, and I want to say something positive.
All on the same team.
Yeah.
Capacity is leveling out after, again, a small COVID drop. And it breaks it out by the different groups, infant, toddler, preschool, and school aged.
Yeah, so I think sort of the point here, right, is that the uptake for CCWP may be limited by capacity, which I think you guys know, because the capacity investments are still playing out. We're starting to see it in some age groups for in terms of the number of children that the programs would like to serve. But it's not taken off quite yet in terms of availability for families.
We did hear, I forget where I heard this, but I don't know if it was that Let's Grow Kids thing, but that looking at, what we're seeing in anticipated as well as, new programs and expansion of programs, that it looked like there was something like around 1,000 new spots available for families.
Yeah, and
coming on board, not yet.
Yes, that's
yeah.
right. So they're not there yet. And again, the startup process for that, some of them are some might have a 2-month startup period, and some might be it's 2 years because it's a major construction effort. But that is funds that those grants were issued by First Children's Finance and with funding from Child Development Division from ARPA. So the state.
Thank you. Representative Hyman.
Thank you, Chair. To that question, I was wondering if the department has the numbers on maybe county by county and what form of, is it it's a range system, right? So we have like daycare centers and we have
Family childcare. Registered and licensed.
by what type of?
By county?
Yes. We can get that. I would like to.
Yeah.
I know in Chittenden County we have growth. I'm wondering if we're getting in the rural areas the kind of growth that they need also.
Yeah, and we definitely can break this all out by program type and program location.
Thank you.
Thank you.
OCS.
Next up is the Office of Child Support. We did ask the director, Lisa Rivers, if she wanted to attend. She could not, and said probably for the best. Not a lot going on here on this chart, and nothing surprising, at least. The Office of Child Support improves children's economic security by establishing, enforcing, and modifying child support orders for children who do not live with both parents. And they also improve economic security by collecting, recording, and distributing child support payments through the Office of Child Support Registry. And you can see that in fiscal year 23, the office served over 14,000 child support cases, 14,000 children, and collected and dispersed 41 million in child support payments, and as such is a key economic support for Vermont children.
Can I ask a question about that? I know that this entity serves as sort of a collection point, and the money goes out to families. And you might have data on this on the website. If you do, just refer me there. I'm just wondering to what extent, like what percent of parents or guardians who are supposed to be paying child support are actually doing so? What's sort of, I don't know what the correct term is, if it's the collection rate for the unit or what it is. And if we could understand that a little bit better, that would be great.
Yeah, good.
I know they've had a very good success in the past. I just don't know what the current information is.
We'll follow up with you on that.
Okay, thank you.
Not a lot of changes to the budget. It's Pay Act and ISFs. No, nothing broken.
And next is the AABD, the Aid to the Aged, Blind, and Disabled. It's a program that provides financial supplement to recipients of federal SSI who are over 65, disabled, or blind, and don't have sufficient income to provide a reasonable subsistence needed for their well-being as defined by law. It also funds the Essential Person Program by providing cash assistance to household members whose care is essential to an aged or disabled person in the home. See the caseload averages there, and those caseloads are down. And Sean, you want to speak to the numbers?
Yeah, personal needs allowances was the item from, was it last year or the year before? It's been implemented as of January 1st. So we are building that GC into the base for the personal needs allowance there was a specific group. And then it's a caseload adjustment down. And again, the graph, you can see that that's a pretty precipitous drop there. Essential persons is pretty level, but the SSI supplemental group is on decline.
So are these number of people? Is it the chart? Is that the number of people?
Caseload, I believe. Let's confirm. Yeah, household.
Deputy Commissioner Gray, is that something you can confirm?
Yep, and we will confirm. I wanted to say that it is.
Yeah.
Of course, the reason that I ask is because we actually hear these numbers are going up, and if this is caseload, I'm curious about whether people know about the program, know about the, but I know we also have different population bands sort of, moving through the ages. So I'm just curious about that a little bit, about, why we're seeing that decrease. If you could provide some additional information, that would be great.
Do that.
And make the slides better next time.
Well, it said caseload, so I was presuming it was, but it could also be the amount per case. I wasn't sure exactly what it was. Yeah.
Okay, and on the next slide, talk about 3 squares. It's the Federal Supplemental Nutrition Assistance Program, SNAP, which I understand you were hearing something about recently, which provides low-income households better access to a healthy diet while supporting American agriculture.
Fully federally funded. We're not asking to adjust this year.
And just some narrative here about 3 squares that you can can read, unless you'd rather we presented it or had any questions for the Deputy Commissioner.
I don't need to be the only one asking questions, if other people want to ask questions. We did hear about SNAP, as you came in today, it was SNAP Day at the State House. So we had some very moving testimony just before you came in. And I didn't know exactly what ICANN was. So thank you. I went earlier in the slide, I was going to ask you, but I see it written out here. So what are you seeing for changes as the benefit levels have changed post-COVID and, the supplemental piece of it has gone away. And, we heard this afternoon before you folks were here of significant additional support being needed in our communities for older Vermonters and families and individuals accessing our food shelves and our community resources as the price of food has not gone down, but the benefit level has. And just what kind of outreach do you do? What kind of data are you collecting around the impact that's having on individuals who have received this benefit?
Yeah, we are seeing a steady decrease in our caseload, I guess I would say, with not having that larger increase to both the benefit, but then also there's some other waivers in place that would allow people to be able to access food. And we are hearing from our community partners that folks are needing to access food shelves more often. And I don't know what else to say there other than yes, things happen. Without things are really expensive. And that is a challenge, I think, at least weekly, sometimes daily, though, that I'm hearing about people who are really trying to see if we, looked at their case correctly because they're feeling like it's really hard. And so I'm always happy, actually just got an email just now from another representative who asked if I could look into a case, and it is people that can just be on the cusp. And really feel like they need this benefit, but we are beholden to the federal guidelines making eligibility determinations.
And so in some programs, in your department and other departments, we supplement the federal benefit when we see that there's a need in our state. And is that something that you have considered and decided against, or what's the thought process on that?
I think it is something. There is a bill, but I know that's in the Senate, and actually the director of SNAP testified this morning, not in particular about that piece, but there's a strong piece. What is challenging for us is that this is a 100% federally funded program, and so that means that our staff are federally funded, and so to add in general funds, all of a sudden have a large impact. Also, the tracking of the benefit, the issuing out, there's a large spider web of implications on doing this and how much it would cost Vermont to be able to administer a supplemental DF benefit. I don't have that full analysis, but I don't think it would be insignificant as I look at what it will cost for us to run summer EBT, which is coming up next. There will be an expense.
And I'm just wondering, I don't know exactly what the Senate bill says, but there's, I guess, different ways of doing it, so making a supplement to a federal benefit, and then there's you can have a state only benefit. And it would seem more logical, I don't know if this is true or not, but it would seem more logical that having a supplement to a federal benefit for people who've already been determined eligible wouldn't be as big of a lift as trying to implement a whole new state program, if you understand what I'm saying.
I do understand what you're saying. And I also still have my very old IT system. So it's just those components of not having nimble systems to be able to say, here's a new funding stream. And then how does that cost to allocate out across all the systems, and the outwards. So that's, I think, where the challenges are, because it isn't just a matter of there's another piece of money. It's how are we determining that, and our experience, again, kind of putting into that side, but it's I think that's very clear to us that we aren't able to charge our admin time to regular staff or somebody to, even that, even though it's a program that they're mostly important to, but there's a very clear, like, you cannot do that. And so I think we probably run the same thing about the a supplemental.
Yeah, I mean, cost allocation, I get that. Since you brought up IT, and I neglected to mention that during our discussion of family services, I know Deputy Commissioner Erica was probably hoping that I did forget about it, but and this is, I guess, a broad question for, it's really for the department, and I know that the legislature had funded updates, a whole new system really in child development division for the childcare side of things. And could you give us an update on what's happening with, any prioritization of IT changes for, family services, economic services, really any of the antiquated systems that you have, which I know pretty much is everything.
I was gonna say it's a long list.
I know pretty much everything except for, Janet's the one who's got the new system. And that's part of it. It's not without its flaws either. I get that, but at least it's not a legacy system that nobody knows how to program anymore. But so any updates on that? I don't see any particular budget issues addressing that.
There's not a slide addressing it. There are certainly budget challenges with all of our IT systems. We had a presentation yesterday from Michael Blanchard, who's our lead from ADS. And he showed one chart that was particularly kind of shocking, which was there were things in red were the systems that we want to move away from and replace eventually. And it seemed like it was more than half of the systems that we currently maintain. So there has to be a prioritization there. CDDIS went to the top of the list. IE&E is a project, integrated eligibility, that's been going on for many years. I think maybe they have a little bit of momentum now, and some movement on that, but that's still many, many years away in a very expensive system. The CCWIS, of course, is another one that can help us accomplish our mission in a much more efficient way. It can help with staff workload. It can help with our care of kids. It can help with drawdowns of federal funding. So that's of the many systems, that's one of our priorities. We do have some carry forward money and we're in the RFP process. But there is not I don't believe there's a specific budget line item for that until we kind of know what it's going to cost. And we're looking at whether we can do this in a modular way with I think $8 million or so that we currently have in carry forward to do phase one now and then start planning for the future. Erica can speak a little bit more to that, but I think those are the big ones. I don't know if there's another IT system that I'm missing here that any of the deputy commissioners want to chime in on, or Sean.
No, you actually.
Did I actually get it? Do you want to say anything else about CWIS?
With CWIS is that we are anticipating getting our RFP this year. Hopefully by the end of the month. There's been some back and forth with feds in terms of reviewing the RFP. And then we'll have a much better sense of how much the system will cost. And as the commissioner is saying, we're trying to look at the system as a whole, which is what we really like to do, or if we needed to do it in sections as, modular, just to try to get this moving forward, because our system is definitely ancient.
And what part of that, Deputy Commissioner, you said an acronym and
CCSO, it's the Comprehensive Child Welfare Information System. And because what we have right now is sort of a data management system and a case tracking system. It's not really an integrated case management system. So our workers are really doing a lot with spreadsheets and paper and things like that.
And so we all sort of read the press coverage about this earlier this year or last year. So would this system that you're talking about right now, that integrated system, that would enable your family services workers, wherever they are, would kind of follow the child, I guess is my question.
Exactly.
Okay.
The child and the input, it just makes things so much more efficient that you put the information in. And then if the foster parent needs to have access to some information, as long as they have access to CWIS, they'll be able to see what everything we have, they would be able to have, as opposed to necessarily calling the social worker.
Right, with protections, I'm presuming, to certain aspects of the system. Yeah.
And in terms of the 4E drawdown that the commissioner mentioned, that's critical, that we would be able to access additional federal funds that we could use for prevention services.
Well, you just walked right into this little question I have over here. The federal dollars left on the table. So we're aware that there's, we have the summer meal program, but then we're also aware in family services that there is a significant chunk of money out there that Vermont is not benefiting from, but could benefit from. And so with the investment in this CWIS, will we be eligible for that?
It would be eligible. See, what happens is with our current system right now, the Families First Prevention Services Act need to be able to turn off payments for youth when they've been in the system 14 days if they're going to go into residential care.
Mm-hmm.
The system we have right now does not have the capability, it's not flexible enough to turn off and turn on. So we just don't turn it on, because if we turn it on and we leave it on, then we're going to end up owing the feds money.
Mm-hmm.
So we need to be able to have a system that has the capability to do what we need to draw down 4E funds. So we are leaving money on the table until we can get that capability through CWIS.
And so what, you said RFP is likely to be issued, you said this month, but you mean February, I'm presuming. Yeah.
February.
And, I'm not holding you to time definite, but what's sort of a anticipated time frame for that?
We're anticipating it once it's issued. I believe we have 30 days. It's our 30-day term to then, have it out for vendors to make their bids, and then we'll come back and select the vendor, and then we'll go from there. But the issue is still making sure we have funding, because we do have our carry forward funding, and then we'll be able to have a federal match for that type of funding.
Mm-hmm.
So, I'm glad you're not holding it to me. I'm thinking that this should be more of a 4 or 5 month process at this time. That sound about right?
I think that sounds right. And I think I might have said like 9 million in carry forward. That's 9 million, including the match. So I think we have maybe 4.
Yeah, you said 8 million, but.
For something, I
It's
think, in
almost
carry
10
forward.
million if you consider the match.
With the match.
So with match, it's about $10 million. Okay. And well, we don't know, I guess, until you get the responses to the RFP back about whether that would be sufficient to get you what you think you need.
And it really is hard to tell. We've been kind of trying to suss this out, how much federal money we're leaving on the table, because we don't have the data that we can pull from our existing system. So the data can inform how much we're leaving behind. The data can inform things like, there are often things that the Office of Child, Youth and Family Advocate wants to know about. We have to do that in a very labor intensive and manual way to pull information for them. There's so much that if we had a modernized system, we could pull data that would really help inform our decisions, especially around prevention or where we might see some problem areas, or the effectiveness of a program, to be able to provide you with a pretty little chart that says, here's the before and here's the after we made investments in a particular area.
That's absolutely true. And the courts have been interested in us improving our data system, because we work a lot closely with our juvenile justice population, and we're not able to necessarily be as nimble with providing them with data. And another data piece is related to race. We want to be able to make sure we're capturing outcomes and who's coming into our system, to make sure that we're not having an inappropriately disparate impact. There's so much that we can do with CWIS.
Go ahead, Representative Webster.
I'm just curious, at the beginning of this conversation, you had said that this was money that isn't in the budget because it's this one time only. So there's no place. I keep reflecting back to child development, to CDD, when they needed the module be updated, and the feds were really interested in us doing that because we weren't complying. We saw it in the budget every year. You'd see a little bit, and then we would talk about it here and be supportive in order to sort of wrap our arms around such a good, important way to move forward. And yet we kind of just, our chair just sort of teased that information out. I'm just curious, it'd be good for us to highlight that and talk about that as an important part of the overall budget. I mean this to be a question, but it's not sounding like, well, what is the question? Why isn't it somewhere for us to see it?
It's carry forward money.
So you get to
instead of it going to the bottom line, they decided they're going to hold a certain amount. And
carry forward, but to your point, I think it is a priority and is something that we should highlight as something that.
Yeah, like on your list.
Like under development, even if it's not an increase in the budget, as a project that is being undertaken, especially since it's so critical to the welfare of children and youth and the folks who are trying to support them. So I actually have to say, Deputy Commissioner Erica, I felt for you in trying to respond to that. I definitely felt for you. So there are so many legacy systems in state government, and it's a huge, lift, but it seems as though prioritizing that, which definitely, one, will bring additional money into the state, but two, actually one, that's number two. First thing is about the children and youth and their safety and information and their welfare. That, you need any help prioritizing that within ADS, just let us know. We'd be happy to oblige.
And that's my point, is I just want to help. This seems like we've known about this all these years. This is my 8th year, and I feel like every year we talk about this and the importance of it happening. So it's really good to hear that it's going to happen.
Okay, we still have a lot. Oh, yeah, I'm sorry, Representative Garofano.
No,
go ahead.
A couple of people have made comments. I'm just going to make a comment that just given the legacy of the systems we have in place right now, just the amounts that we're talking about are so inadequate that I just want that to I want us to all reflect on that. And I know you all are using what is in your power and trying to be flexible, but as a state, we really need to come to terms with, we are dealing with systems that are breaking and the staff are having a hard time. And it's, we all know this, but like $8 million, given what we need, is literally a drop in the bucket. So.
Yeah, I don't disagree. And it feels like it's so big that it's hard to it's so big across state government that it is, hard to move forward. It's almost like a paralyzing impact because it's so big. But if we could break it down, if I had the magic wand that's over there on the table, I would break it down and say, okay, what's the key priorities, and focus in and move space by space, and obviously, we would highlight Agency of Human Services as being a key place where those investments need to be made and prioritized. And I know they are to a certain degree. So I appreciate that, Representative Garofano. It's a giant number. And even though there's been some pretty significant investments in the last few years, it leaves stuff on the table. So, okay, thank you.
I will just say that, given what we've heard from other states, it's between a $25 and $50 million investment. That's without the match. So half of those amounts for the state side of it. But that there are a number of states who have implemented this system, and they have systems that are fairly similar to ours. So we're hopeful that there's some kind of off-the-shelf solution that doesn't take a lot of modification for us to put in place.
And we definitely learned in the CDD land and downstairs in corrections and institution around the healthcare issue that modularization or whatever the word is, but doing it module by modules and not trying to do a sort of big overhaul all at one time is the sort of the way to go on this kind of stuff. So, Representative Hyman.
Thank you, Chair. That's kind of where I was going, like, that kind of whole state upgrade, I'm sure, has a certain amount of staffing that California might need, but Vermont would not need. And I think keeping it more to DCF versus what the whole state, the need, and importance of what DCF is charged with, what we're asking DCF just to do, to not have analytics on race or sex or, I think I support it.
Yeah.
That's my comment.
Okay, thank you. Anybody else want to make a comment? We're all doing it. I know. That's why I'm asking everybody else. We all having our turns, and I've had more than my fair share. So, I'm meaning that sincerely, Representative Hyman. Okay, let's move on.
Next slide is summer EBT. And you can see that the current benefits, or the benefits would be $40 a month, $120 per summer for eligible school-age children. We estimate with this program that 30 to 35,000 children will be eligible, that the benefits are federally funded, although there are administrative costs, and those are 50% match. And the needs for implementation this summer is approval from the USDA to enroll late, and flexibility in the USDA's current rules. You can see the funding requested here in fiscal year 24 in one time, in fiscal year 25 in administrative base. And I'll turn it over to Deputy Commissioner Gray and maybe add anything else that she'd like to add about the challenges of summer EBT this year and next.
Thanks. There are a number of challenges in actually the community, like the Agency of Education, and then the SNAP director are well versed and really be able to dive down into the weeds. What I can share is that we continue last week, members from both AOE, the Agency of Education, and the SNAP team went to Baltimore on a conference, in particular around this topic, to understand what we might be able to do to continue to put forward proposals. One of those being, and we've had these conversations since the fall, both with the USDA and our federal delegation, looking at how Vermont can do this. And so trying to use what information that we have. So we have proposed using SNAP, TANF, and Medicaid to be able to reach the majority of children in Vermont that would be eligible. And we were told that that wouldn't be acceptable. So now we are trying to look at, could we do that? And could we also, I say this knowing that there's nothing simple, as we've been talking about IT, have an application so that any families we weren't reaching in that way, that we would have an application that we could also try to help promote people being able to apply for this benefit. So that would do this. We're fully committed to doing it in 2025. And we could look for paths forward for 2024 because we do want to be able to provide this benefit. I do know that there was the New York Times articles trying to Vermont and not the greatest picture, unfortunately. Because our other states are doing this for very different reasons. Our view is to say that we could do this and then you couldn't actually provide a benefit because we can't count on this income. But we continue to look and are really looking in every possible direction we can, but ultimately this can come down to again being approved with these kinds of disease, even something I know pretty much in depth because then you'll think that I have more answers than I really do. But just what the age is that children are considered 6-16. Well, we know that that isn't true in Vermont, and so we will have to get a waiver to ask to be able to support GPK in 5-year-old children and now 17, 18, and 19-year-old children. And this has just become a bit more complicated as well because and it's lovely and wonderful that we have the universal school meals, the less people are submitting their free and reduced applications. And that's another way that people can be certified for this. There were enough differences between the pandemic EBT, which we ran, and the summer EBT that have made this challenging. And just the timeline, we got the final proposed rule on the 28th of December, and you have to submit your application, your intent to participate on January 1st. And then there is also the administrative cost for the kind of the PET. So there is a cost to the state of Vermont to be able to administer. That's happy to take any questions.
Any thoughts?
I guess I'm confused about summer EBT. So this is when we approved universal meals. We said, we thought there was going to be a lot of federal funds that would help. And what you're saying is in order to get those federal funds to help pay, we have to have this whole program set up by.
I'm sorry, I conflated.
Okay.
two things. So we have.
Oh, okay.
Yeah.
Okay. I thought when you said that.
This is a separate program. This is universal, the free and reduced lunch applications is a way to be able to certify that children are eligible
For this program.
for this program. Because you have to, this is different. So last summer, many of us in this room probably, or new people who received a card for your child to be able to get this, a very similar benefit. But now this benefit is only for certain populations. And it's not as broad. So that is one of our challenges, is to be able to make sure that we get to the right families. And there is an IT component here, is because we have to unduplicate. Families can come to us in a number of different ways, and we need to only put out one benefit, including we were being held to if a family was in school in Vermont and moved to New Hampshire. They would technically be eligible in Vermont, they can get the benefit in New Hampshire, but they get the benefit in New Hampshire, they can get it in Vermont. So there's just a lot of complexities that we were trying to work through.
I know what you're referring to,
Yeah.
but I guess we'd have to ask our comrades in health education about that.
Okay.
Because I think that was supposed to be education. I think that was supposed to be education money. So when we ask, how does that coordinate with this? But
Yeah.
I don't know that it does, to be honest. So, okay, is there any other questions or comments about summer EBT on the rise? We look forward to having that. And so your budget includes, just to be clear, on the cover sheet, it said 500, but it's actually 600,000, right?
That's the gross cost and the 300 GF, yes.
Yeah.
And that one time, I believe, is also in the C section of the 25 bill for 24. So it'll show up differently as a one time, but it's in 24.
Well, thank you for clarifying that, because I didn't recall that being in the BAA. So you're making very interesting use of the FY25 budget in your department for 24 costs. Okay. All right, let's move up to Reach Up.
Sure. Next up is Reach Up, and a little bit on the Reach Ahead pilot. Reach Up joins families on their journey to overcome obstacles, explore opportunities, and improve their finances and reach their goals. And services include educational employment supports, case management services, and monthly cash payments to pay for necessities. Sean, you want to walk through the numbers?
Yep. So internal service fund, slight reduction here. There's not staffing here, so it's fewer ISF impacts, able to reduce that a little. Act 133 annualization. So that this is to make a full year. I think last year we had 6 months brought in. This is to bring in the second 6 months. So we'll have a full year's worth of funding for the Reach Up bill. PNMI changes. Again, I think that's a few different lines for the inflation. Inflation adjustment baseline, as well as the rate increase. So that's a couple of components there. Revenue adjustment. So as I mentioned in FSD, this is the other side of that revenue adjustment with the TANF state plan, where we need the GF on this side and we're reducing the federal funding. And then Reach Up caseload adjustment. We have a consultant that provides the Reach Up caseload protection for us. So this is tying into an estimate from that resource.
Great. Let's go through Reach Up and then we'll have questions on it.
We have a slide on the caseloads.
Caseload looks pretty close to last year's 22 and 23.
Miranda, anything you want to add there?
The next slide talks about the slight increase in the reach out pilot. We'll be happy to share more as we know more, but because the pilot has just started in July, we are seeing an increase in our reach out load. And we were able to put out the first incentive payment, which is $750, and that was 137 families. And so we'll be outreaching to those families to understand how do they use that money and what are they thinking about this incentive. So just part of our, because this is a pilot, trying to gather this information so we can look at successes or is it what we thought it was going to be.
Yes.
Thank you, Madam Vice Chair. So, Miranda, is this me reading that the Reach Ahead pilot will not be continuing in fiscal year 25 or?
So it will go, although it gets a bit tricky because of when the benefits could go out. And I'm happy to come back with more details, but there is a certain time where people wouldn't be eligible to get a benefit, an incentive because of when the pilot ends. So I think yes, but there will be a point where people can continue to be enrolled. That makes sense, or to be able to get the incentive the way that the language was written.
Yes, I remember that multiple months out and then you get additional payments and we tried to rework that. That was not found favorable. But I guess the question is that the Reach Ahead pilot was just for fiscal year 24. There's going to be a review of folks who received these payments following, and we may or may not see that in a future budget after that review.
Potential.
Okay. Thank you.
Is there a report due on that so we can look at it and make a decision?
We're going to send a report. And
Excuse me, it is a 2-year pilot. And I'm not positive, but I have to imagine that we are gathering the data to be able to share successes. So whether or not a report was required, there will be a report.
Oh, good.
Check.
Okay, that would be great.
no.
No, okay.
Okay. 2-year plan. So then the funds for the second year are going into the base funding, or we're seeing that separate?
It was all in one appropriation. I think both years of was a single appropriation.
Okay. That's all I have for now.
Okay. Anyone else that has reached out? Okay, I think we're good. We're glad to see the pilot going into effect. And I really do want to see the results. I think government accountability would say that this is really an excellent program. And we've noticed, I mean, over the years when I worked on Reach Up, that there was often money that got dropped. And because we didn't use it up inside the program. And so we were always talking about that. I'm kind of curious this year, did we do that this year? I haven't been watching it as closely as Representative Small, but were we able to use all the money that was in the Reach Up program, stayed in the Reach Up program? No, how much dropped to the bottom line again?
Yeah, bring that for two.
Okay,
Sean,
you know,
we're-
we talk about this every
Almost
year.
$1 million.
Wow.
Yeah.
And we know these are the poorest of poor families, so any help they could get would be so incredible. So
That's about half of the Reach Ahead pilot program money.
okay, well, the
Mhm.
folks who are working with you more closely so that we can talk about how we want to move forward on the policy piece. We'll do that because this is definitely, we regularly talk about this. I know, Chris, you haven't been here, but this has been a big deal for us because the Reach Up program is really our families that are right on the edge, living in really difficult situations. And it's hard to believe that we couldn't take some of the money it's right there in the line and reinvest it in the people in that program. So.
Do you have a Reach Up report coming to us from our bill last year in November?
Okay. Oh, good reminder.
Yeah, it's due tomorrow.
Okay.
Also, there is a March report on basic needs, and then we have our annual. So you were
Okay, thank you. That's just one of those things we'll bring this up every year if we have to. Until someday we don't have to. We actually. Okay, let's move on.
So Representative Brum said, with your permission, I'd like to skip to the next to the last slide, which is the final thing for Erica. And also, I think we're done with Janet. And if possible, we could release them from this sitting on the sidelines while we discuss other things. So the next to the last slide is about secure residential treatment facility. And we just thought we needed to include a slide. It's a very important priority of ours, knowing that DCF is developing a state-of-the-art short-term secure crisis stabilization and treatment facility, that is a mouthful, that will provide holistic, trauma-informed, and developmentally appropriate care for justice-involved youth here in Vermont. The issues leading to a youth needing this level of care include destructive or assaultive behaviors, a mental health crisis, placement disruption, or concerns of risk to self or others, or the likelihood of going on the run. The purpose of a short-term placement is to give the youth the opportunity, time, and space to de-escalate and to provide a clinical assessment and understanding of his or her needs going forward. And I haven't forgotten the request from this committee to tour the temporary short-term secure facility. We actually just had furniture delivered there yesterday. So it's looking almost ready for occupancy and definitely ready for a visit from the committee. So we'll be in touch to have you folks come and take a look at what has happened in Middlesex. And we're excited to have one small piece of our high-end system of care restored and available. We are still working on getting a provider. We're very close to that. There's nothing that we can announce publicly yet. But we are very close, we think, to having someone ready to run a program there. And then you won't see anything in the budget for the proposed permanent state-of-the-art facility that I've just described here, because we're taking a kind of a different approach that lets us move faster and without a capital investment. It's a design build. It's a developer who's going to lease the property back to us with an option to buy at the end of the lease. So those costs will be annual going forward. We put out an RFP. Those RFP responses are due back on February 9th. We are looking at 2 communities and 3 different builders who bid on this. We first vetted a whole bunch of builders who had experience in this and asked them to express their interest. We narrowed it down to 3. Those 3 have put in or will be putting in bids on February 9th. And then soon after, we'll make a decision on which builder, which community to go with in this. And then it'll be at least a year out from that before we build, from putting shovel in the ground to getting a facility up and running. So we're looking at least 2026 from a year for design and a year for building. So 2 years out from when we grant the RFP. Meanwhile, we do have the temporary facility in Middlesex that will be available to us. We do have some carry forward resources that we're making available for that site. We had, I think, $1 million in the budget last year to help identify a plan for the permanent facility. But we wanted to make sure that we included a slide here and answered any questions that you might have about the temporary or the permanent secure facilities.
And Representative Dunn had a couple of questions.
Yes, the first one you answered when you went on, because when I saw developing state of the art and we're talking about this year's budget, I meant the
magic wand.
Middlesex. No, I thought you meant
Okay.
Middlesex facility being state of the art.
Definitely not state of the art.
But I did have a couple of questions. One a smaller one. You referenced mental health crisis as one of the areas that would make use of that. Does that mean I'm just not clear about mental health crisis versus justice involvement and whether this kind of facility is right for addressing a mental health crisis? Is that the intent?
Yeah, I turned to the deputy commissioner and kind of the interaction with the PRTF that's also
PRTF is
residential treatment facility, which we do not have a.
Okay.
So for this one, this would be for youth that are already justice involved, that perhaps disrupted out of the placement and have had some type of mental health crisis or issue that then has led them to really need to stabilize short term in this type of facility. So it's a little bit different than from the psychiatric residential treatment facility, the PRTF, but you may or may not be justice involved and have to, be an inpatient there.
Okay, thank you. So the secure residential treatment facility being described here is not the mental health one. It's not for the mental health crisis.
It's more just that you have a, constellation of issues and symptoms, so they may actually have a mental health crisis, but they're justice involved. Yeah.
So actually, my primary question is about the advisory committee, because it sounds like things are moving towards decisions, and I'm hoping the advisory committee contributed to the decisions and reviewing of the communities and the builders and the RFP.
I do not believe that the advisory committee was involved in the review, but Erica can tell you to what extent they have been involved.
That committee is being run by the Tyler Allen. I'm sure you've heard him testify. And what we have them do is really, it's a lot of stakeholders. They haven't necessarily been weighing in on the initial parts of the plan, because that had been going on before the stakeholder group was developed. But now he has taken the strategic plan, Act 78 plan, that's actually due to been submitted to the legislature last week. They did actually go over the plan and have a significant amount of input in terms of what's going on as far as race, and ethnic issues, making sure that that's appropriate for who would be going to this facility once it's created, and also any other ideas in terms of program and developing. And they are even talking about the number of youth that might be appropriate for the program. These are all issues that anything that's still up in the air that hasn't been seen into or moving forward with an RFP, these are issues that Tyler is bringing up and talking to the legislative group, stakeholders group about.
Okay, I guess that's helpful. I have to look at the Act 78 plan. Didn't realize that had.
Yeah, it's not there yet.
Yeah.
I can give you an
So
idea who's in the group if that helps.
Well, maybe, but I can just look at the report, but it sounded like there was a little bit of an overlap. We had two different input groups or reports that were expected. One was specific to the disproportionality question. That was completely separate from the stakeholder group on development of the program. I have to say, I'm really disappointed that there wasn't weighing in, even if it was only a start of a committee, not a full committee, on really critical aspects of the program, like who's the builder going to be, what's the RFP going to include, what are the communities that are appropriate, because that's the beginning point of decision making. And if they're left out in the first part, you're getting into details rather than core components. And the intent was to be involved right from the beginning. But I'm glad that they're beginning to be able to weigh in now. And hopefully, if the RFP hasn't been returned yet, I would assume they will help evaluate the quality of the responses to the RFP.
I don't think that's the plan at this point, Representative Donahue, to have them weigh in on the RFP. We have a committee of BGS and DCF people help prepare the selection criteria, and would be looking at what we're trying to do is, and I understand your concerns. What we're trying to do is move quickly.
I recognize that, but I think when we've asked this kind of thing in the past, and it involves from the start, and I'm not sure why some representative members of the advisory group couldn't be a part of that review, even though regrettably they weren't part of discussing, what the expectations should be in it. That being able to weigh in, that's what a fundamental group like this, and I think the intent was made really clear from the beginning, not when it's the later decisions, you know.
We do have, I guess what I would say is precedent for a group like this being involved in reviewing the applications and giving recommendations. I mean, we realize that BGS and DCF have the ultimate decision-making authority. We recognize that. But when we went through a similar process with Dale, and the housing initiative for people with developmental disabilities and the grants that they were issuing, and they said, "Oh no, we can't have this advisory group be part of this." And we said, "Oh no, that's contrary to legislative intent, actually." And the same is here. You know, our intent really is that people have the opportunity, even with, you know, the selection criteria that you've identified. Again, I agree with Representative Donahue. That would have been good to have them involved in the development of that. I guess what we're asking you to do is to go back and rethink that, and to find an appropriate way to include them in making a recommendation to you. And again, it's a recommendation. You may end up with valid reasons for either not following the recommendation or some part of it, or you may find it very valuable to what it is that, you know, you're undertaking. And we do understand the need to move quickly, and they can, I'm sure, can accommodate that.
I want to mention the other example where speed was, you know, after Irene, the replacement for state hospital capacity was of critical, urgent speed. But stakeholders were involved right from day one. They were part of the user group. They were part of the selection of the RFP, and all of those things. Choosing the contract for and the architect were all part of what the advisory group was involved in. So,
just sort of on a general basis, the more that people who are going to be impacted by the decision are involved in the decision making, you know, whether it's child development division, whether it's family services division, or you know, OEO or economic services, any of those kind of you know, hopefully as state government, we're looking for opportunities for people who are directly impacted to be involved. This one we happened to put in legislation last year. So we really would ask you to go back and sort of rethink that.
Thank you.
Thank you.
And Madam Chair, we jumped out of order just a little bit so that we can hopefully release Janet and Erica at this point, if that's all right.
I think Representative Noyes has a question.
Just a quick question. Thank you. So this is all short term, but we also have youth and long-term placement. How many out of state?
You know that one, Erica?
I don't have that number offhand, but the idea is to move folks back from out of state once we have the.
Would this facility have the capacity for the number of youth that are housed in out-of-state treatment programs to bring them back here?
With this, it's a moderate, you know, it's a modest building. It's not huge. So it's 15 beds. I think we will have the capacity to bring some back, but not all.
Okay. Rough number of how many are housed in out-of-state programs?
I have to get you that number.
That would be great. And do you know if there's any resources in the budget for them to have connections with their family members if they're housed further than you can really drive?
There are resources in the budget. We've actually funded individuals, families going to visit their youth when they're in residential treatment. And we also make sure we are going monthly to visit them as well. But no, we will pay if you know, they don't have funds. Okay, it's important that they have that connection.
Great, thank you.
I think ideally we bring as many kids home for treatment here in the state as we can, but there are some programs that we just don't have in Vermont that might be appropriate depending on the individual. And so I think we would continue to utilize some out-of-state programming, but hopefully less.
Yeah, I'm just wondering what the numbers are in relationship, because a few years ago it was pretty high, I felt, and I hope to see that drop down. So thank you.
So I feel like I need to ask this question regarding this particular program or facility. has the department, or the governor's office made a decision about what you're going, location, of this facility and use of the Newberry, property?
So with the Supreme Court decision, we do have the Newberry property available as an option. It's still under consideration what the use might be, given the overall kind of the system of care as a whole, and knowing that we're moving forward with the Middlesex secure facility on a temporary basis. We have this RFP out for a larger permanent secure facility. We have to reevaluate what we're doing in Newberry. We do want to still keep that option on the table, but there hasn't been a decision made on that yet.
So I do understand you're looking at other communities as well,
Or
for the treatment facility.
for the permanent secure facility,
Yes.
it's a bid on the RFP is based in 2 communities where there is available property. We have one that's a private piece of property that's been made available to us, and the other is state-owned property.
And are you at liberty to say where those properties are?
It's public, it's in the RFPs, it's South Burlington and Virgins.
Ready? Any other questions on this area? More to come, right? More to come.
Absolutely.
Okay. So, I think the answer would be yes to your previous question. It's very nice to have you here.
Thank you very much. Oh, and I did have, as far as the stabilization and support, it's 80, not 70 additional slots.
Okay. Okay, all righty. Thank you so much.
Quickly, do you know the title of the Act 78 report that you said is in? Because
It's not in, she said. It's not
Oh,
in.
I'm sorry. I misheard that. I was busy looking.
Yeah.
Okay, it'll be coming in soon.
Okay, thank you.
Thank you both for being here, and thank you for putting up with our line of questioning, and appreciate really the difficulty of everything that you're doing and balancing at the same time. So we generally do appreciate it.
Thank you.
All righty, take care.
And so we've jumped out of order just a little bit. If we can go to the very last slide, jump back to LIHEAP, and then all we'll have left is housing and emergency shelter.
Okay.
So the very last slide is the Office of Disability Determination Services, DDS. It provides applicants with accurate medical eligibility decisions as quickly as possible, as governed by the Social Security federal statutes, regulations, and policy, with full and fair consideration of each applicant's situation and respect and concern for the individual's well-being and legal rights. And just some stats on DDS: processing 6,250 cases in fiscal year 23. They achieved an initial case processing time of 79.1 days. That is the fastest in the nation. And in fiscal year 23, Vermont's decisional accuracy on initial claims was 99.4%, also #1 in the nation. So we have a really great DDS group over there doing great work. And Shawnee, I don't know if you want to speak to the numbers there at
It's
all.
a 41-person position, base budget, and so you can see the pay act. There was a large RFR class action last year too, so this might be a little higher than some of the corresponding groups, but that's been factored in, and then slight reduction to the ISS.
Thank you. This is, it's nice to see the efficiency with which the unit is operating. And this is a place where I would say maybe to DIVA and long-term care Medicaid eligibility, that they might learn from the efficiency and speed and accuracy with which disability determination is doing their work, because that takes significantly longer to process those applications. I love it when we can recommend to other departments to look within the Agency of Human Services and see examples of things. And, you've served as an example twice today already. So, okay, let's move back.
Right. And so going backwards to the home heating fuel assistance, the LIHEAP program. DCF's fuel assistance program has 2 components. There's the seasonal fuel assistance operated by Economic Services, and the crisis fuel assistance operated by the state's 5 community action agencies. And here's just the FY 25 summary and highlights. These are federal programs, not much to see here. We do have households by heating season, the number that have been served by fuel assistance. And I defer to either Miranda or Lily, if she's still hanging on back there online, to make any other further commentary on LIHEAP and the two programs. Yeah.
What kind of oh, okay, go ahead, Representative Hyman.
Thank you, Metro. The numbers are pretty steady, and I'm wondering if there's any money or any training for people enrolled in this program to transition off of things like that necessitates fuel assistance. Heat pumps, I mean, working with OEO and other organizations for the amount of federal money that's out there. I mean, is this another situation where we're leaving federal dollars on the table because 20,000 Vermonters needing fuel assistance when something like a heat pump would negate the need for fuel at all? I'm wondering if there's any coordination in regard to that.
So I think we do coordinate, and I can't also tell if Lily is on the line
She's still there.
To be able to jump in. But I will say too, I mean, just the cost. And I hear what you're saying to switch over. I think there's a lot of costs that are associated with that as well. And that's certainly Lily's area of expertise, not mine. I think it's like just the cost of maintaining law. You might be looking at upgrading, but things just cost more money right now with fuel prices. And when we're talking about people with significantly limited incomes again. And so I think that's why you're seeing that.
I understand that, but
Right.
for example, there's federal money and state dollars that aren't being utilized for specifically upgrading. And is there any coordination between yourselves and the organizations that are trying to get this money out? OEO in particular.
Yep.
Yeah.
So maybe Lily could, if you're there, if you could, this is Interim Director of the Office of Economic Opportunity, Lily Sojourner. We do have a few slides on weatherization and their weatherization program and how they may connect particularly people in a lower income bracket to weatherization that actually helps them save money in the long run with efficiency and weatherization of their homes. You want to say a few words about that, Lily?
Sure. And I don't know, Sean, if you want to jump to that slide. We do 4 out of the 5 community action agencies are weatherization agencies. In the Northeast Kingdom, it's a different agency, but the crisis fuel programs and the LIHEAP programs, they all make referrals to our weatherization program. And we are currently taking advantage of the ARPA funds. Next year, we'll be able to start taking advantage of the bipartisan infrastructure law grant funds. So that will help as the ARPA funds start to decline in the state to kind of bolster the growth that we've had in this program. So our primary focus at OEO is to support our weatherization assistance programs in hiring crew, working on their efficiency and effectiveness in terms of how many units they can produce each year. We have seen an increase from so far this year from last state fiscal year, so that's positive. And again, we work with each provider. I will also know, and Miranda, you can chime in. Does LIHEAP also, though, include an electric benefit if that's the household's primary heating source? And I'm not sure if that's how that is included in those numbers before, but we absolutely are working with our partners and continue to work with them to increase the units that they're doing, and work with our partners in Efficiency Vermont. They really help get out the word about our program, and they're there to help other Vermonters too who are looking to make similar home improvements.
My chair, can I follow up? Do you have the data? And I know that we're all working with antiquated systems. Do you have the data on how long, for example, the 19,526 people of 2023? I mean, how long have they been in the fuel assistance program? Do you have that kind of information?
We have to see, if we do, so I have to follow that up.
Because I mean, I would think that if for a certain, I'm sure some people are in the system a long time. And is it possible then to target those people or those individuals or those families with requiring efficiency upgrades when possible? Because if the state's spending $3,000 a year on one family and it costs $3,000 to put in a heat pump, then if we could, to save money, we could just tap into those other federal dollars, state dollars, part of our, our climate change goals in the state. That we fund the money, and I know that the money isn't necessarily getting out the door and so coming back to us. And I'd love to find out like how long certain individuals have been in this group.
Can I ask a follow-up to Representative Hyman's question? So does this also pay for folks who need assistance with their electricity, their power bill? Heat made me think of it because run on electricity. So if they're utilizing that for
exports.
Yeah, I'm just not the weatherization necessarily, but I guess I'm thinking about the fuel. When we say fuel, is it literally fuel? Or okay, all right.
It's oil, propane, kerosene, coal, wood, pellets, or electricity.
Or electricity, okay. So then, I'm just following up on what you said, Representative Hyman, if there's money on the table for people of modest means to be able to convert, that's actually not in your budget, then why wouldn't we utilize that to help people reduce their energy costs and the state's cost in their assistance?
When I say, I know maybe not in their budget, it's been budgeted.
Yes.
Yeah, okay.
Yeah, no, I'm agreeing with you. Yeah.
Wanted to clarify.
Yeah. So I guess sort of the general question is, what are we doing to help people recognize climate action as part of these programs that provide assistance for fuel and other
Of course,
things?
people spend the most money for heat and electricity.
As a percentage of their income, for sure. Yeah, thank you. Good question.
You started.
Oh, I'm sorry. Representative Noyes had a question.
It's actually more of a statement. I just really appreciate your investments in the weather, in the live heat program. I know that it's really needed in rural Vermont and the communities that I represent, and especially with a lot of older Vermonters and working with Miranda just recently on our wood bank program where we engage volunteers and cutting firewood for people. So thank you for your help there.
I think you had started to ask about what special fund it was. So you'll see the special fund in live heat, weatherization and OEO, and you'll see on the weatherization slide, we actually are asking for an extension of the fuel tax. So we've historically done it as a 5-year renewal, and we're doing that again this year. It's set to expire in June of 24. So we are asking for in language, you'll see the 5-year extension request, section E for the home weatherization assistance program fund.
I thought that was a lot more money than what Capstone was raising in their tire sale. Okay. Just curious, but the special fund is coming from. Any other questions around weatherization and/or light heat? Okay, let's move to housing.
Okay, so next we have emergency general assistance. As you know, GA provides emergency financial assistance to eligible individuals and families. That might include help paying for personal needs and incidentals, housing, fuel and utilities, medical and burial costs. And you'll see, I'll just jump right in here, Sean, in the line by line, security for hotels and motels continuing. Miranda can speak a little bit to that for where we have made security investments for our hotel motel program, support services caseload, P&I caseload, and total base changes. I think the things that I'm sure you're very much interested in are the one-time GA, where we have an additional item for $16,500, the base GA, where it's $7,500 for a total of $24,000 on GA for FY25. And then I'll just, add in, because they are so closely tied together, the next slide, the Office of Economic Opportunity, which administers funds to help organizations address poverty through community initiatives, direct services, something you just heard about, in the areas of financial capability, homelessness assistance, and community services. This includes core federal funding for community action agencies and homeless shelter and service providers. Here, the two line items I'd really like to call attention to are the permanent supportive housing initiative and the shelter bed expansion through HOP grants, which is an additional investment in the base of $7.2 million for expansion of shelter beds. And, maybe just to try to explain a little bit how we got to this point in this budget. I know that we all share the goal of getting emergency housing for people experiencing unsheltered homelessness and permanent housing for all the people who are experiencing homelessness, but who might be temporarily in some of our emergency shelter system or in the GA housing system. As you all very well know, it's a housing crisis. It's an affordability crisis on top of many other complex problems that so many Vermonters are facing today. And again, I think we agree that in order to achieve that goal, we have to change the environment that we're working in right now. We have to focus on some creative and bold ways to bring more affordable units online. And in this, I'll just mention very quickly ACCD's investments in the VHIP program, the Vermont Housing Improvement Program, $6 million for that. $4 million for Healthy Homes, $2 million for Manufactured Home Improvement Repair Program, and a $2 million increase for downtown and village tax credits, which are all in line with the push toward regulatory reform and incentives to create more housing units. Because without more units, Vermonters can't afford houses, they can't afford rent, and more broadly, we as a state can't afford to continue paying for overpriced hotel rooms while units and additional shelter beds are coming online. So it's units. As you know, we need more of them. But in the meantime, we are expending so many of our resources on hotel rooms. Our focus has to remain on prioritizing housing for the most vulnerable. That's families with children, those with disabilities, and those over the age of 65. And as I think we continue to work really hard to connect all of those folks in the cohort to the services, supports that they need and to permanent housing. I think the number as of this morning in the cohort, and I know you, Madam Chair, doesn't want us to refer to the cohort anymore, but it's, I think, 630 or so households still in the cohort. That means more than 600 that have moved out of the hotels and motels, many into permanent housing solutions since the June 1st. But I think in the bigger picture, until we change the dynamic with the hotels and until we reduce our reliance on them, we're going to have a really hard time negotiating prices. We're going to have a really hard time controlling spending or making significant gains in additional shelter space through the conversion of hotels, either to lease agreements to operate as shelters or to turn them into affordable housing units. So we believe that every dollar that we put into the hotel motel program could really be better spent on community-based shelter with the support and services that more effectively move people into those permanent solutions. So this proposal that you have before you, this budget, recognizes the reality of what we have to spend and the need to move away from the hotel motel program. The dollar amounts you see here does reflect a reduction in eligibility. So more specifically, the $24 million being proposed reduces the available days for all of those in the GA housing eligibility categories to 28 days. Where currently some of those in the catastrophic category qualify for 84. So it's a reduction to 28 days in all eligibility categories. It also, our calculations and projections here assume a room rate of $100 per night. That was before the $75 cap rate was proposed. And given the room cap rate, the cap rate bill or potentially our success on negotiation of rates, these projections would have to be adjusted so we could possibly do more than is proposed here if it's less than $100 a night. This proposal does continue the adverse weather conditions under a hybrid model like we are using this year, but it does focus only on families with children, those with disabilities, and the elderly as those that we currently cover. That's about 1,100 of the 1,600 households that we are currently housing. So that it does mean an additional, if utilization is constant as to what we are doing this year, it would mean an additional 500 people would be turned away next to adverse weather next winter. We do know that negotiating reasonable rates is essential to progress. It's incentivizing lease models, and the conversion of hotels and motels has been successfully done many times over, but the pace of that is really too slow. So in order to operate the program in the coming year within budget, we will update the rules to prioritize eligibility. And this is unwelcome news. This is hard news to deliver, but we believe it's the reality of the decisions in front of us now. There are no easy answers. There are no quick fixes, but until we change the dynamic and the environment that we're operating under, we don't feel like we're going to make a lot of progress. This budget does include $7.1 million in additional nearly 7.2 in additional base funding to support emergency shelter capacity for an increase of approximately 180 shelter beds to our traditional shelter system. And as I mentioned, the budget also includes money for the permanent supportive housing Medicaid benefit. And Interim Director Sojourner can speak to both of those, the shelter expansion and the permanent supportive housing piece of this proposal. And I think but I will say again, the folks at DCF and the providers in the field have been working extremely hard to try to add capacity, to try to connect people to services and to help them succeed. We would love to invest more in prevention. We would love to invest more in the shelter system. But without the units and without a change in how we're using hotels, we simply won't make progress quickly enough. Anything budget-wise that you think I missed, Sean, that you want to add before questions?
Trying to figure out how to be polite. Well, first off, I appreciate the difficulty of delivering that news to this committee. And I think that that we've begun work and we'll be continuing work on how to modernize the GA program. And I put that in quotes. I'm pretty sure this is not the exact direction that we'll be going. I can say that I think we have recognized that funding is not unlimited. So we do get that aspect of it. I think it is not responsible, honestly, for us as a body to frankly even consider consider implementing what you've proposed. And I don't think that that's exactly what you were expecting to hear from us. And I certainly didn't want to disappoint you in that regard. I know that I've had conversations about, what is the capacity that we need in the state of Vermont? What is the capacity that we need to shelter people who have, for one reason or another, become homeless? And it is very difficult to say, well, we'll do that for you, but we're not going to do that for you. And yet their issues may be just as dire as another person's, and maybe more dire, for a single person experiencing some very traumatic issue, when we may have a mom or dad with a child who might actually be able to go find a place with a relative or something. And so it's a little bit arbitrary. And I know that there are lots of questions around the table, so I'm going to be quiet for a moment. But I do want to, I'll let other people talk, except for I want to talk first about shelters. Thank you for your attendance last night in Waterbury, where we had over 200 people online and in the room around I guess what I have to say, it was a hastily put together proposal to utilize the Armory building. And I support, shelter capacity in that community, which is my community. But there's no plan for after July 1st, and there's nothing in your budget for anything after July 1st. And I think you heard in the room last night, with them, are you just going to close up shop and close the doors and, say, go off and, land wherever you're going to land? It seems illogical to me to spend $890,000 on a building that, and then potentially up to another $1 million retrofitting it. So $2 million on a building that you're going to use for that purpose for 3 months doesn't make any sense. And as somebody did the calculations, it's actually way more than what we're spending on people to stay in the hotel. And I realize they get more services and supports in a bona fide shelter. I do get that. But it just is not making logical sense. It doesn't really pass the straight face test. I'll just be honest about that. And, so we need a lot more information about how that $4 million is going to be spent. That's in that since the department has mixed up FY24 BAA stuff in their 25 budget, we're going to be asking about questions about that $4 million and really what it is, are the plans for that, and how that gets rolled into your 25 budget, which it doesn't seem that it is. So there's just a lot of logic here that just doesn't really follow. And so I'm going to now be quiet and I'll make my way around the table. Representative Small.
Thank you, Madam Chair. I definitely have heard that the hotels are very expensive. And so I'm wondering why we would have a $1.4 million reversion in general assistance if this has been so expensive.
We can talk a little bit about, a lot of that was prior year, the one-time ARPA or ERAP funding coming in and helping to credit some past year expenses too. I didn't bring a ton of information on that for today. But it was.
Is that another one? Is that another 24 reversion in the 25 budget?
No, that is, well, it's part of the reversions. It's not that 24 spending is earlier in the budget here. There's like a.
Is it in 25? I guess is what I'm asking you.
Well, yes, it's carryover. It's dropping down to the bottom line in 25.
Okay, that's my question. Yeah.
Right. Okay. Since you brought up the emergency rental assistance program, I also see language in here around the authorization to reallocate $5 million of federal funds. I want to know if that's going to be staying in rental assistance or if that would be reallocated to a different part of the budget.
I don't know the answer to that. Do you happen to? So we'll get back to you on that one.
Great, thank you. Now getting, I share Madam Chair's, I'll say I'm really appalled by, we asked for a plan and the plan is that people are going to be kicked out onto the streets. And I think what really stands out to me is that adverse weather condition policy, which a lot of Vermonters have genuinely survived on. And so I want to make sure that I'm understanding this correctly. If someone does not qualify under the General Assistance Housing Program and they do not have children, they do not have a disability, and they are not over 65, that means that they will be out on the streets in freezing cold, inclement weather.
That is correct under this proposal.
We do also have the emergency, like extreme cold shelters that we pop up as well, just to, that's not really answering your question, but I did just want to note that that is a tool.
I appreciate you bringing that up. And do we currently have enough housing for folks who are already being turned away from the hotels in those inclement weather shelters?
So we did the extreme cold weather, we haven't actually had to open one yet for weather conditions. But yes, we are to separate that. We in the economic services are turning away households right now because we don't have space just in our hotels.
And just to clarify, Representative Small, in the scenarios, the models that we ran, that's about 1,100 households that would qualify under the categories that we're talking about, of the about 1,600 that we are currently housing in hotels and motels.
About 500 households that will be out in freezing cold. Okay. Also want to clarify, so now we are moving, it doesn't matter if you are a vulnerable population or a catastrophic population, everyone gets 28 days. So that's inclusive of folks who are fleeing domestic and sexual violence.
That's correct. That's the eligibility that we're proposing.
And there's currently a pool that is used for our agencies in addressing sexual and domestic violence. Will they still be able to put people in hotels, or will now they be restricted to this 28 days?
I don't know the answer to that. Yeah, go ahead, Lily.
Thank you. Sorry to interrupt. They will not be restricted to the 28 days. They're not restricted to the time limits now. They operate those motel pools in accordance with their shelter policies. So really, we look at the motels in that case as an extension of the shelter. And, ideally, if they have their beds opening, they're bringing people, back into shelter from the motels. And that's how they administer those now and how they would continue to do that.
That is very helpful to know. I will.
Can I just ask a clarifying question about that from Representative Small's question? So if you're fleeing domestic violence and you don't have children and you don't have a disability and you're not plus 65, how do you fit in? Is that another separate category?
In emergency shelter or in GA housing?
In either. Because you could be somebody fleeing domestic violence, not have children, not have a disability, and not be 65 plus.
You would qualify for the 28 days.
But you just said these are the three categories of.
For adverse.
Well, you said for all categories.
Sorry, for.
Adverse weather.
Adverse weather.
It is going to be the same as regular emergency housing.
I'm sorry, I'm confused now.
Did I mishear that?
I will try. Yes, I believe that you did. So
Okay.
we have all of the categories that we had previously under catastrophic and vulnerable,
Okay,
except for 28 days. Adverse weather, separate and aside, that is for families with children, those with disabilities and over 20 years.
okay,
So that is for 28 days. Someone under that is domestic violence would be eligible for the 28 days.
okay. So, regular GA housing assistance, if you're homeless, it is going to fall under the existing catastrophic? Or I'm trying to picture in my head. I picture in my head three spots. So the AUC, the catastrophic, and then the regular GA. Emergency housing part.
Right, and so both the catastrophic and vulnerable fall under our regular GA. Generally speaking, of people here, well, I can actually say that. Pre-pandemic, we would run 2 programs. Right now, we just have 3 because we have the cohort program as well.
Right.
So
right.
it'd be, everyone gets 28 days, but when it comes to adverse weather, then we have these 3 categories.
And did I hear you say that you're eliminating the difference between 28 and 84?
Yes.
So catastrophic would qualify for 84 days under the current program. Vulnerable qualifies for 28. We're proposing everyone goes to the 28 days.
You could have gone in the opposite direction.
Yeah. And just to clarify for you, Madam Chair, that includes the death of a spouse, that is an emergency medical need, a natural disaster such as floods, court-ordered eviction, domestic violence, and sexual violence.
Okay. Yes, moving down the line, Representative Whitman and then Representative Hyman.
Thank you. Yeah, I just wanted to ask the hybrid adverse weather condition, is that year round? Or is that limited to a certain number of months? And if so, which months would be covered? So there's night to night and then there's date to date. And when we do both, we consider that hybrid. So Miranda, maybe you could lay out what the current program is.
Night to night is November 15th to December 15th.
Based on weather conditions.
Weather conditions, yep. And then it's just, sorry, it should have been 14th, December 15th until March 15th is not based upon weather conditions. That is just when we allow house people. And then we transition back to the night to night depending on weather to March 15th, April 15th.
And so basically from April until November of any given year, those with children with disabilities and people age 65 and up would not have access to shelter and shelters. They would be eligible for 28 days if they haven't used it, or 84 days under the current program if they haven't used it yet. But they are by calendar year, is that correct? 28 or 84 days.
They would also be eligible for traditional shelter, right, for shelter first state. So that would be where we would go to.
Shelter first state. Kind of oxymoron. So what would be really helpful, and maybe you've done this already, would be to have a comparison of current policy to proposed policy. And
Chart.
a chart, that's what I'm
Yes.
talking, that's what I'm
Yes.
talking about, a chart, yeah. And comparison of FY 24 budget in that category and FY 25. And I know that there was a bunch of one-time money in 24. I know you're asked, you've got, I forget how much up there, but you've got one-time money in 25 as well. So that would be helpful in helping us evaluate this proposal. Have you done any work to determine, what it is as a state? So, we're a state of 600,000+ people. We have 14 counties. We have, some population concentrations in, several parts of the state. We know there's sort of 5 hot areas in terms of homelessness, but that it exists all across the state. Have you done any work to determine what the state's capacity needs to be in, I guess what I would say is a bona fide shelter capacity as well as, perhaps intermittent or minimal use of hotels and temporary lodging?
Yeah, I think, last summer, I gave some testimony saying we needed 1,000 additional shelter beds. I think that was roughly the number at the time. We do know where people are sheltered now, whether in hotels or in our traditional shelter system. And then we do have, I think, homelessness data that we can match up with that. So we kind of know where the needs are. I'm sure someone has done this. I'm not thinking of it off the top of my head or don't have it at my fingertips, but I think we know, generally speaking, where the capacity is. It is, or where the need is. It is, and we have done this with housing units. The ACCD has really been crunching a lot of numbers on vacancy rates for units and where we need to build more units. I think the homelessness in the shelter data is somewhat skewed given how many people we put into hotels in Rutland. So that might be a slightly an outlier the way that looks. But I would say, generally speaking, I think we know how many beds we need in each of the hotspots in particular, probably in each county as well.
So if we could have, a summary of what exists currently, what's under development and what you see as the need, so that we can assess what the difference is and what resources might be needed there, that would be also very helpful. And since you brought up ACCD, I was going to ask this back when you were talking about what the ACCD budget has. Do you know, is there any focus in ACCD around whether it's acquisition, building, renovation of housing, a very special focus on people with very low incomes, people essentially living on disability, of which we know make up the major proportion of people who are receiving emergency housing. So do you know, and we can ask the commissioner in to speak to that, but I know that there's been work between the two departments and agencies, and has there been any input from your department into the need to develop permanent and/or transitional housing, permanent, for those individuals with very low income?
Yeah, there's a lot of collaboration going on there to make sure we're connecting, in particular, people who are experiencing homelessness with some of the new units that are coming online. With the VHIP program, I think we're using coordinated entry, and Lily and Miranda might be able to speak to this a little bit more, to match up people with new rental units that are coming online through the VHIP program. There's also the mobile home unit program. And I know it's been a part of a lot of our conversations with the governor and team about matching up folks who are currently homeless with some of these manufactured home sites that we're looking at, as well as the VHIP programs. I don't know if Miranda or Lily want to add anything extra about that coordination that's happening.
Sure. I think the home ownership centers and the coordinated entry lead agencies in each community are working together to help support the referral from coordinated entry to landlords participating in the VHIP program. And that continues to be a great resource to bring units of permanent housing online that have to be affordable. They might not always, come with subsidies or meet the needs of the lowest income, but that's been great. And similarly, utilizing coordinated entry to kind of verify that people going into these mobile home units, et cetera, are participating in coordinated entry and are experiencing homelessness. So I think, that is actively happening right now.
Okay, well, we'll have the commissioner in to also speak to that. Representative Small.
Thank you, Madam Chair. Just a couple more questions for today.
This won't be our last, this will now be our last opportunity to talk in particular about this proposal, shall we say? Because, we'll be taking this up as part of our GA modernization discussions, and we'll be having all these same folks back.
In regards to the now, I guess we're going to need more community resources in responding to this proposal if it were to move forward. And I look at the annual OEO payments out to the community agencies to assist. And I see that in fiscal year 24, we gave about 18.8 million. And this year we're looking at about rounding up 18.7. So I'm wondering why we have a reduction in funds going out to communities if we're going to see more people out on the streets.
Sean, maybe you could help because I'm not sure.
This would be E 325.
Because we are proposing, and again, Sean, help me out in terms of just making sure I'm tracking this, but we are proposing an increase of the 7.1 million for increased shelter expansion. So again, this is to fund some of the shelter capacity that we've started this year with 5 projects with one-time funding, as well as to support 3 programs that should be coming online next year and are receiving some sort of state support this year.
Yeah, is that the budget language that authorizes HOP, and then how much is in HOP?
It is indeed, yes.
Okay, so we were looking at that, and so it's a good opportunity that we did want to flag that, as I think that number needs to be updated to what our current base projection is. So if the dollar amount that's in the budget is going to be specified in the authorization to do that activity, it should tie. So
Wonderful. And then last question for today is just about the permanent supportive housing. I'm very supportive of that. 700,000 for about half of the year. Is that just because of how long the project will take to come online, or?
Lily, could you
Yeah.
speak to that?
Yeah, sure. Thank you for the question. Yeah, we are working right now to finalize the benefit. We'll be putting out an RFI, request for inquiries shortly to get, or interest to get more detail from provider. We want to make sure that it's a sustainable benefit, that providers can actually take advantage of it. We want to make sure that we have a good benefit in terms of who it's serving and what the referral process is. So it really supplements existing permanent supportive housing projects and really meets the identified needs. So we're still doing some of that work right now. And then, we'll be looking at data most likely, because it is estimated for about 100 households with this funding. We will most likely be looking at certain communities to launch this in the first year, and going through then an RFP process, contracting process, as well as sort of an onboarding and training process to make sure that they are, ready to go January 1st.
Thank you, Lily.
You all set for now?
Thank you, Chair. I think we all agree.
Can I interrupt just for a second? No, I just want to catch Representative McGill.
Absolutely.
before
Go
he
ahead,
asks
Julie.
me.
Yeah, so Taylor, covered most of mine.
Yeah.
I just want to confirm when Representative Whitman asked about clarifying the dates of the adverse weather conditions, you gave current years. Is the plan that those would be the same dates next year?
Same
Or
date
would that change?
with reduced eligibility categories. Yes.
And then just confirming, I'm pretty sure I know the answer, disability, you're still using the SSI, SSDI rather than the definition that is laid out in the Americans with Disability Act?
Still using SSI, SSD.
Thank you. So, do you have something that I was gonna wrap up, because I've been sitting in the witness chair for a very long time.
Like, wow, disappointed. So, I'm an 8.
Recognizing that you've been here a very long time, and recognize that we would definitely have you back, and that you will, all your staff will be hearing from we have a 6-person team that has DCF, various divisions of DCF. I do want to say thank you for being here and going through this and answering our questions so thoroughly as best you were able to. I think that there certainly are some highlights here, but I have to say, taken in total, we're disappointed with this budget. And frankly, just doesn't feel to me, this is my personal opinion, that it reflects the needs of Vermonters. And that feels like what we're supposed to be doing. And I recognize this constraints with which you receive instructions from the 5th floor, and I know that that's difficult. I guess it's our job to see whether or not that is going to be sufficient to carry out what Vermonters expect of state government or not. So we'll be back in touch with lots of additional questions, and as I said earlier, we are continuing on our the new sort of code term, GA modernization trek. And so appreciate very much the time you spent here, and like I said, having all of your staff and the depth of knowledge that they have, and understanding the jobs that you have are very difficult. We really think among the most difficult in state government. So thank you for your time here today.
Thank you, Madam Chair. Thank you to the committee for your time. We really do look forward to working with you, and I'll have to agree, I have a great team here that makes a lot of great things happen for Vermonters. So,
Thank you.